I think we can get started. Namaste, everyone, for joining for Sunday, like for the aging and age-related issues class. And hope everybody had a good New Year's and Happy New Year to all of you. Today is an interesting session about aging and age-related issues. And let's get started on this. Okay, let's start with opening prayer, everyone. Please sit straight and close your eyes, and let's pray to the Almighty that everything is well for everyone, and pray for the best. Okay. Oh. Sahana bhavatu, sahanau bhunattu, sahaviryam karavavahai, tejasvinavaditamastu ma vidvishavahai. Om Shanti Shanti Shanti. Good afternoon, everyone. So wherever you are, good afternoon and good evening for some of you. Let's get started with session 9 with Mukundji and Rakiji. Today we would be going over a couple of sessions here. We have 3 topics to cover. One is aging and age-related topics. The first one is aging 200. Cognitive vitality and dementia. This is led by Rakiji and co-hosted by Mukundji. This is about the cognitive vitality and dementia. And the second topic we will be having is aging 300, which is the fundamentals of elder care and geriatrics. This is hosted by Dr. Mukundji. And the last one is 400, aging 400 class, which is also hosted by Dr. Mukundji. And this is how the caregivers, care for caregivers is a topic. And we should be discussing all of those here. And as we are progressing, like this has become a very common problem, like I guess in most of our families, as we have aging parents. So hopefully this is very informative for all of you. It has been a great honor to listen into this class from my last class. So let's get So today's class session is like from 1 to 1:15. We have the resident learning objectives of each of the sessions. And from 1:15 to 2:15, Dr. Rakiji will be going over the cognitive vitality and dementia session. And after that, 2:15 to 2:20, we have a small break, followed by aging 300 class with elder care and geriatrics by Dr. Mukundji. Sorry. And after that, we have a little longer break, 3:20 to 3:40. We have the break, a second break. And from 3:40, we'll be going over aging 400 for caregivers with Dr. Mukundji. And after that, if you have any questions, we'll discuss the homework objectives, followed by closing prayers. Any questions or any concerns, anybody? Okay. I will quickly go over lesson number 200, lesson objectives. And this is the bulletin description is like Mayo Clinic says the cognitive vitality is essential to quality and survival in old age. With normal aging, cognitive changes such as slowed speed of processing are common. Cognitive decline is not inevitable but can occur in individuals with genetic predispositions. Conditions such as diabetes, hypertension, hyperlipidemia also contribute to cognitive decline and onset of dementia in older people. As do lifestyle factors such as smoking and excessive alcohol intake. Lifestyle factors such as lifelong learning, mental and physical exercise, continuing social engagement, stress reduction, and proper nutrition may be important factors in promoting cognitive vitality in older adults. The course will provide an overview of this topic and practical techniques to maintain cognitive vitality and recognize the warning signs of dementia. And we have uh, like Raki ji, who is an MD as a physician. She's been practicing, specializes in family medicine, geriatrics, and hospice and palliative care. After completing her residency and geriatrics fellowship in Chicago at Loyola University, she will move back to the Bay Area to complete her second fellowship in hospice and palliative medicine at Stanford University. She has an extensive experience working as palliative care physician and hospice medical director with a non-profit hospice agency. She currently divides her time working as hospice medical director and palliative care physician at Kaiser Redwood City. Outside of her work, she likes to spend time with her geriatric boxer dog, energetic 3-year-old son, and her husband with whom she competes as a gardener. So good to know that she has been losing ever since her husband started working from home during the COVID. Yeah. So the course here provides an overview of cognition, educates scholars on the role of brain health for successful aging, informs scholars about dementia and its complex path, describe caregiver training and crisis of caregiving for dementia patients, describe multiple ways to maintain the brain health, understand the evidence-based approach to cognition and brain health, provide a curated list of resources. So I hope everybody had a chance to go over the lesson plans, and I apologize that it was uploaded a little late. That was on my part for not getting that and had some few technical challenges on the way. So I hope everybody had a chance and you will have a great class. And I will hand over to Mukundji right now so he can go over a little bit introduction with Raki ji and take it from Raki ji would be doing the class after that.
Thank you, Anita ji.
Thank you.
Can you stop the screen share for a bit? So wonderful. So welcome everybody to the first CHT session for 2022. Happy New Year to all of you. And while this is continues to be a strange year for us through the pandemic, I'm hoping that this year at least we'll kind of see the decline and of the pandemic. It's never going to go away. I don't think it'll be endemic in our society, but hopefully we can return to some measure of normalcy in the future. But in the meantime, we will continue to do our best in all the things we do. And part of that is for the HCI to bring to you the best we can in the CHT program. I wanted to put today's talks in context in the overall program, and I want to start with what I always do with each of my sessions is to tell you folks, the scholars and others listening in, that you should approach each of these lectures with what have I learned from it? How am I going to use it in my own life? And how am I going to use this information in service to the community? And if we are not able to answer those questions, you should be asking us, what have I missed? Help me answer those questions. So with the CHT curriculum, a significant element of it is knowledge-based. And so the 5 courses in the aging series are designed to give you that knowledge, that information that'll help you understand yourself better and help yourself, help your family, and help your community better. You recall in my first CHT Sunday session, I think back in session 3, I gave a lecture on healthy aging, where we talked about what healthy aging means in terms of quality of life, in terms of being able to function, that we could live the best life we can live the best life we can, regardless of the state of our health, if we follow certain guidelines, and looking after our body, mind, and spirit, finding sense of purpose in life, and so on and so forth. So that kind of talked about aging in an overall way, and kind of giving ourselves a, how shall I put it, a goal for us to strive towards, in terms of being as healthy as we can, both personally and as a community. Um, Today's lectures, the 3 of them, plus there's one more, Aging 500, that comes later on in the year, are designed to give you information where we go beyond that aspiration of living the best life we can, but understand that at some point we are going to deal with reality. We all have to, as we age, deal with some reality in our lives. And so to give us that knowledge base, as well as that perspective, so that we can do the best we can for ourselves, and for our family. And the courses are designed to give you a certain piece of information about what happens as we age, what can happen as we age, and how we can deal with it. And together with aging, we link caregiving, because at some point, all of us are either going to need care or receive care, or at this point are actually either needing or receiving care from others, right? So aging and age-related issues and caregiving are kind of linked fairly strongly. So you'll find some measure of both topics being covered in these. So as Anita ji pointed out, Raki ji is going to talk to us about cognitive vitality and the effects of what happens when that's affected, dementia, Alzheimer's, and so on and so forth, and how to deal with that. I'm going to then, in the next lecture, talk to you a little bit about elder care and geriatrics. Now, I have to be careful because we're talking in front of an experienced geriatrician, but I'll do my best not to misspeak. And if I do, Rakiji is going to be here to correct me and guide you folks well. So I'm going to talk about elder care, geriatrics, and some element of care, the requirements of caregiving from the perspective of the patient, right? And then the third and final talk for today is going to be about caregiving for the caregiver. And that's a whole new topic, which requires actually a lot of attention, because most of us as caregivers ignore that, which is to our detriment and to our family's detriment. We need to understand what are the things we need to do from a caregiver's perspective when dealing with health issues. So those are the 3 topics we'll cover today. Anita ji has given you the background to what Raki ji is and does, but I just wanted to add a couple of words. Raki ji is a good friend of Sukham and good friend of HCI. She believes in the visions and goals of both organizations, and we are so happy that she's able to take the time from her busy practice to be able to contribute her knowledge and her wisdom and her experience to us in the lectures. You'll be seeing her once again later on in the year when she talks about the medical needs of the people over the magic number of 50, right? Medical needs of 50 plus. But today she's going to talk to us about her core discipline, which is geriatrics. And from that perspective, she's going to, um, to describe to us what cognition is, what cognitive vitality is, and how to deal with issues related to dementia. And she'll explain dementia and Alzheimer's and those kinds of things to us. I'm really happy to say Rakiji is a good friend of ours and very happy to have her on board here. And look forward, Rakiji, to your talking to us today. So thank you so much.
Yep. Thank you so much, Rakiji. So I really enjoyed her class, so I think all of you will too. So
thank you so much, Mukund and Anita ji, for your very kind words. I'm going to, how do I share the screen?
Do you see a share button on the bottom?
Yes.
Yeah, just click on that, and then you will be able to share your whichever document or whichever screen you want to share, and select that document.
And Rakiji, if you're having problems with it, if you like, I can also share your document and help drive it for you.
Yeah, can we do that, Mukundji?
You want me to do mine or yours, Mukundji? It's up to you.
I can do that. Just give me a second. I'll load it up. And
I have that presentation too, so in case.
So here it is. All right, so
did it work? Can everyone see the slide now?
Yeah.
I tried something, Mukundji. Did it work? And can everyone see the slides?
Yes, if you can, maybe you can go to full screen, go to view and go full screen. Yeah.
Is this good?
Yeah.
Go back to the first slide.
Yeah. So good afternoon, everyone, and welcome and I hope you enjoy this talk about cognitive vitality and dementia. Anita ji did go over the course objectives, and I can kind of go over it again. It's talking a little bit about what cognition is, what's the role of brain health, and we'll talk a little bit about what are some of the strategies for successful aging. Talk about little tips about caregiver training, especially when they are in a crisis moment, taking care of patients who have dementia at different stages. Different ways to maintain our brain health as we age. And at the end of the topic, there'll be some references to where I got this information about. So, aging, it's not a disease. It's a process, and we have the largest number of older adults worldwide. The average U.S. life expectancy back in the 1950s was about 64 years. As you progress things with more development in medicine and with new inventions, it went up to about 79 in 2015. But the latest census back in 2020, it went down by 3 years. So it's now about 77.3 years. I feel that we're still in the middle of an epidemic and pandemic, and we'll see how this eventually does affect our overall life expectancy, because as all of you know, with the mass number of deaths we've had because of COVID, a big majority of patients were in from the nursing home. So I feel it will eventually definitely affect the US life expectancy. The reasons for different, our life expectancy is different, like immunization, medication invention, technology, better care, different facilities, advancement in medical health. It's not an unstoppable process, but it's variable. Essentially, if I had to put it, it's an interactive process, aging, of lifelong influences. Things like our hereditary, the environment that we are in. Our culture plays a big role in how we age. The diet, being which is influenced by our culture, where we come from, exercise, any illnesses, past or present, and many other factors. All of these accumulate, and together they affect our aging process. And that's why it's a little bit more complicated, because when you're in your 20s or 30s, or even for as children, it's easier to anticipate and how we're going to grow, how a child is going to go, or as teenagers, what stages or milestones we'll achieve. But as we get older, the aging process, it becomes a little bit more individual. So one person may age very differently from the other, and simply because it's aging is affected by so many of these factors that I mentioned. So this topic, and then followed by a couple of more discussions or topics by Dr. Mukund, we'll be talking about what is successful aging. Essentially, it's having a healthy body and a sound mind, and finding the right balance for each person. This is more like a Q&A, or some myths that are out there in the community, where, and I just, everyone can already see the answers. So the general myth is that everyone over 65 is going to have Alzheimer's disease or dementia, which is not the case. There's there's a general notion that, oh, as you get older, your level of intelligence is going to go down, which is again not true. Is dementia a part of normal aging? No. Sorry, so dementia is part of as we get older, are we going to have more acute conditions and more chronic health conditions? Yes. Everything, more the acute things transition to becoming more chronic things. For example, if one has heart disease or lung disease, most of these medical issues become, chronic issues, which the process is about how to manage them in a good and effective way, so that we can successfully age. That's the goal that I usually have for most of my patients, even if they have simple things like if they have high blood pressure. The goal is not, I know, and I try to educate them that, it's not going to be possible to, completely cure the hypertension, but how we can manage it successfully. Generally, people, younger people sometimes feel that after retirement, people either become ill or soon. I think retirement is also now a very moving target. Some people want to retire earlier if their circumstances allow them to, and want to explore and do other things. And some people like working for a longer period of time. And for them, retirement is not really a thing that they look forward to, and they want to continue working for as long as they can. Also, as we get older, we become more spiritual. So what are the ingredients that you want to look for a cognitive vitality? It's focusing on three things, which I call them as 3 M's: your mind, your mobility, and managing your money. Having a good positive outlook can definitely help people as we age. It helps them, continue to contribute in a meaningful way to the community in whatever work they may do. It could be as simple as, doing, volunteering, or doing something, at the school or the library, or maybe as something more complex. For example, Anita ji mentioned her father-in-law was a surgeon, and he was able to contribute back to the community and work for such a long time. And the money, or the managing the money part, is important, because as we age, all of us, I feel, we need to make a very conscious effort to plan, and have a backup plan, or a plan to handle our health issues that may possibly come up in the future. So nothing should be coming as a surprise, because as we all know, we all are aging and we are in different stages. So having a plan would be really helpful. And also for family acting as caregivers for their parents, or for other relatives, or for friends, I think having a support group for them. I'm going to take a little pause and see if anyone has any questions or thoughts so far. I'll keep going. So what are the most common risk factors that we see for aging? Chronic diseases like hypertension, diabetes, arthritis, heart disease, kidney disease. The risk factors where, where I've said self-management, sometimes, when we get diagnosed with this, and then we kind of settle into a routine, not being proactive about our medications, or, the treatment that we're getting, and sometimes, resorting to what a lot of my older patients tend to do, is self-managing their medications. That kind of is a very fine line, and it can, sometimes be a little worrisome for the physicians, because then you kind of run into other problems related with self-managing your own medications. Cognitive problems or dementia, which we'll talk about a little bit more. As we age, some risk factors are when we see, if someone is having a fall, if they're having to go to the hospital again and again, hospitalizations. So whenever I have a patient who's had falls, or for some reason or the other, they're having to to go to the hospital, every few months, or they've had to go to the emergency room, that's a big red flag for me, that, we need to step back and take a better look at what their overall care is, trying to assess their psychosocial situation, trying to assess what's going on medically with them, with their medications, and trying to also assess, the plan or that I am offering as a physician, does it match or does it work for them in their home environment? Because sometimes as physicians, we can offer so many things, but we have to make a conscious effort, especially for aging patients, that what's being offered, does it work for their care? Are they willing to take it? Do they have any challenges regarding those medications? You commonly see too many medications, not having good access to healthcare, a lower health literacy, the living alone or the social isolation. I think that's been such a big challenge. I have seen it so much, at least in the last year and a half, for aging patients being alone, not having the support of children, or for family members or even caregivers. That's been a huge impact. This is just a picture view of how we are as we age. So I've been using this word cognition. If I had to really define it, it's a process of perceiving knowledge, being able to use that knowledge for problem solving, using our judgment and reasoning. It includes language and memory. So when we age, there's a notion that, oh, we are going to lose, there's going to be a decline in everything. As we age, the changes in memory are more of like the process or the speed which we can think, our attention span, and our reaction time. So those are things which are normal physiological changes that we see as we age. The biggest three changes that happen when we're aging are, apart from different levels which happens at different levels, at the cellular level, at the tissue level, but the three organs that are affected the most is our heart, our lungs, and our kidneys. Essentially, what's happening is, if I had to put it in really simple words, is, for example, if someone at the age of 20, their heart is strong enough and to be able to pump 20 times the blood that one would require to be able to stay alive. But after the age of 30, the reserves, or the ability for the heart to pump as well, it keeps going down by 1% each year. So when we're aging, the reserves for our heart, our lungs, and our kidneys, they start going down. So that's when, if you have heart disease, because your reserves are going down with age, that's when you have, when you hear patients, oh, they had a really bad episode of heart failure and they had to go to the hospital, or they took a certain medicine for an infection and it really affected their kidneys. It's the ability, because the reserves have gone down, the ability of the body to bounce back from any little setback. It could be an infection, or it could be as severe thing as cancer. So the reserve, because of the reserves have gone down, the body is having a harder time to get back to its previous baseline. So what is not a part of normal aging? Your memory loss, the short-term memory loss. If you see or if you hear about friends or family members, if they start having changes in their ability to plan or execute things, poor judgment, finding words, and they're talking and they have difficulty finding words. Good examples are, when I am talking to my patients, I try to ask them simple things like, if it's a couple, I'm trying to ask them who's doing most of the chores in the house, and if there's been a change in that. If the spouse, either spouse was managing the bills, and suddenly they're having difficulty managing the bills, that's a good red flag. Something has changed. Or they were driving and they went for groceries, they got lost, they couldn't figure out the way back home. Or not being as social, like someone who was very social and would go out for different activities, if they have a certain hobby that they've followed for their entire life, and now suddenly they're not as engaged, they're kind of withdrawing from it, or they not making not making it for those kind of events. Changes in mood and personality. Someone who's not been as short tempered, but suddenly they become very short and they get triggered by simple things or word questions. Those are simple cues to look out for. Now again, these are subtle signs to ask or to look out for. I do it as for my patients, and when you're talking about this for the scholars, these are things to look out for when you're concerned that someone may be may have cognitive impairment. This is more of just of a visual cue of our of our brain. There are three parts: the amygdala, which processes our emotions. The cortex is is responsible for all our senses and all our sensations. The hippocampus is which keeps or stores all our long-term memory. So as physicians, we very commonly use a term called as mild cognitive impairment. I would say it's an intermediate stage between normal aging and versus someone who has dementia. for anyone to have dementia and, to be diagnosed with it, someone may have the warning signs, but for anyone to be, diagnosed with dementia, they need to have neurophysiological testing. So as a physician, I am very careful of using the term dementia loosely for any of the patients I see in the clinic, because of what I said earlier on. There's a certain, once you get associated with that term, it's very hard for families to kind of disassociate that term. So I try to be very careful, when I'm saying that, and I want to be really sure that someone actually has dementia. If there are concerns that the family is bringing up by certain events, like we talked about, they're no longer able to manage their finances, they got lost, they're unable to follow or do simple chores that they were able to do, that make me at least concerned that they may have cognitive impairment, that I may put down in their medical chart, but I would definitely want them to be, seen by a neurophysiologist before I say that they definitely have dementia. There are some simple screening tools. One of them is called like a mini mental status. It's a set of questions that we can go through with a person when we see them in the clinic. It kind of gives us an overview of, if the concerns, that we have about cognitive impairment are high, and then refer them for the next step of proper evaluation and diagnosis. But like I said, I always try to be extra careful of what we're putting down, because I wouldn't want someone who doesn't have dementia to be labeled with that.
So Rakiji, can I interrupt for a
Yes.
second? So is this more like anything related to genetic, like this Alzheimer's and dementia, or is it more like anybody can get it kind of a thing?
Right now, the verdict is still out. Like I said, all these factors that, play a role in aging, yes, they do have a role. Um, the more the role of genetics becomes more predominant in cases where we have seen dementia diagnosed in really early age stages, like for someone in the early 50s, or 60, or even like I would say in the 50s. That's
Okay.
when you want to look out, and you want to do any, if there is any genetic screening, we want to look at that. But in general, there are several factors that may contribute to someone getting dementia versus one not getting it.
Okay.
For example, then there in families of siblings, one may get it and the other may not.
Mm. And if they need to like kind of pre-diagnose, like, so you're saying that they can make appointments with a neurologist or neurophysician, right?
The neurophysiologist, yes.
Physiologist, okay.
So a neurophysiologist is they do a very detailed screening where they go over several questions and templates. They get a very detailed history. So that's how we make a final diagnosis, because there are really no scans or tests to find a good way. So the screening is really the way to do it.
Okay, thank you.
So going back to dementia, it's a general decline in our mental ability.
Sorry to interrupt. Are you okay with taking questions during your talk?
Yes, I'm okay.
There are two people who have raised hands. I think Nishtaji and then Ritaji. So.
Oh, yes. Sorry about that. Go ahead, Ritaji.
I think Nishtaji was first.
Okay, sure. Hi, Nishtaji.
Thank you. So what I wanted to find out, my mom had Alzheimer's and dementia. What are the chances of inheriting it? I mean, what is the percentage? And secondly, I heard there is some blood tests that can be done where they're looking for some marker for dementia. Is that accurate?
So to answer your first question, and I may have to go back and look into a little bit more detail. I don't know the exact percentage of what the chances of, of one inheriting it from their parents is. For the blood markers, I know that whenever there's a concern that they may have dementia, they always want to, they do run the whole list of blood tests to make sure that anything that is reversible is not being missed out. If there's a specific marker, I'm not aware of it. Do you happen to know the name of the blood test? Or
I actually do, but I don't have it in front of me. I'll look it up. Thank you, though.
That'll be helpful for me to know as well.
Okay.
And Rita ji, you had a question for me? Or if Geeta is...
I can. Okay. Rakhi ji, I can. Yes, it's a Geeta.
Hi, Geeta.
Namaste, Rakhi ji. Actually, yes, it's a very interesting and at the same time very scary also. So how can we, is there any tools to differentiate between dementia and Alzheimer's without diagnosing? And is there any remedies or is there any activities we can reduce the symptoms?
Yeah. So going back to, the first question was, and is there any way of diagnosing it?
That's what I was asking question, Rita. That's Rita. And I think then she jumped and I stopped.
Okay, sorry.
That's okay. That's okay. That's quite okay. Yeah, that's what my question was, like, how can you diagnose? Because sometimes we, with the aging, we forgot the names and we forgot something and all kind of things. So how can we diagnose, like, okay, what is the first steps to find out, like, okay, you have a dementia or Alzheimer or whatever? Is there any blood test regular when you go for checkup with the physician? He can let you know, and then you have to go with the neuropsychologist or neurologist or something like that? Or how do you first steps? What is your first step?
So the first step, unfortunately, we don't do like for some kind of diseases where you do screening blood test. We don't have something like that for dementia.
Okay.
Usually, usually it's the partner, the caregiver, or the spouse or the family members who will bring up certain changes that they have noticed in their loved ones, and that usually is a good way or a trigger for me as a physician to find out more as to what changes have they noticed, and if that has been a consistent pattern. All of us sometimes forget words, names, and but if that's happening regularly, if that's consistently going on, and we feel that the memory has been declining over the past several months to years, and there's a pattern to it, it's not a one-off event, that usually gives us a good cue as to maybe we need to look into it a little bit more. As a geriatrician, we do some simple screening questions or tools. It's called as a mini mental test. Now that's a very crude way of figuring out or assessing if someone does have cognitive impairment, or if this is different from normal aging. When we do move to that step, and we do notice that yes, they do have cognitive impairment, and probably it's a little bit more severe based on the screening test and the score that they get, then we refer patients or their caregivers, and we talk about moving on to the next step of having a more formal diagnosis.
Okay, then you can go with the neuropsychologist.
Yeah, so they do a more detailed screening test. It's all clinical based. There are really no scans or blood tests to say that this person has dementia versus this does not. Even the what they talk about, like noticing plaques and tangles, is in postmortem, when they did an autopsy of the brains in patients who had dementia. Those were the changes that they noticed. But these are all post after they had passed away. Right
Oh.
now, there are really no good diagnostics, tools, in terms of like tests, like PET scans or CT scans that will be able to, pick up all of those things. When I talked about the blood test, they want to make sure. A lot of times, low vitamin B12 levels, if someone has Parkinson's, if they have a history of alcoholism, those can also contribute to the overall, picture of dementia. And those patients may have dementia, but other than, just having it normal, as part of, someone got dementia, there could be other trigger factors, like if someone has Parkinson's. Some Parkinson's patients go on to develop dementia. Some people who have a long-standing history of alcoholism, they go on to develop dementia. So there are different trigger factors that could also be, causing to the eventual diagnosis of dementia.
Thank you. Thank you so much.
There are a lot of medications that are started for patients who have dementia at different stages, preferably at the early stages. There is no cure for it. It's mostly managing the symptoms that they may have from dementia. A good example would be, there's a colleague of mine whose father recently got diagnosed with Lewy body dementia. And after the diagnosis, the focus for my colleague has been mostly around managing the environment. They have, her father was also put on some medications, but the goal of those medications was more to manage the symptoms that he on and off and on some bad days has as a result of the dementia. It does not really, the studies are mixed, that it does slow down the process, but there's not been really good evidence that, it makes a huge impact, and it does not reverse the disease process for sure.
Okay.
Geeta ji, your question is answered too?
Yes, thanks.
Okay, thank you.
So this is what I talked about, a normal brain versus someone who has Alzheimer's. You notice more what we typically call as amyloid plaques or tangles. And, there's a difference in what, someone who has a normal brain versus someone, with Alzheimer's disease. There's overall shrinkage in the overall volume of the brain, in addition to all of the tangles and the plaques that they see on autopsy. So
I'm sorry, can I have one more question?
Sure.
In that case, meditation and everything can help. If you see like the brain shrink, I saw this brain shrink. The meditation or yoga or anything like that help in the beginning stage?
That's a very good question. And I'll be talking about a study that was done in Finland, and I'll be addressing those. So I'll be coming to those things.
Okay, thank you.
So what are the changes or what causes that? There's a damage of the nerve cells in the brain. It could occur in several areas, and depending on where it's been affected most, different patients with dementia have different symptoms. Some have more behavioral symptoms, some have more physical symptoms. So depending on what area of the brain got affected, the symptoms may be more pronounced in one person versus the other. So I think this is what we all are kind of wanting to know and talk about, as to what are some of the ways to protect our brain, and what's going to be good for our heart and brain, as we get older. So the finger study, it was a study done in Finland. It was one of the largest studies that was done to figure out and work on ways to review what kind of interventions that people adopted at different stages of their as they were aging, helped prevent cognitive impairment and disability. And they gave it a short term name for finger. So these are some of the findings that help routine screening. I think the underlying message for all of these, things that will help us with healthy aging is, what I like to say is, we try to, even when you're younger, is, when you're trying to learn a new habit, is being consistent. So I think all of these screening, all of these tips and tools for healthy aging, I think the underlying message is consistency. Routine screening, having frequent and regular, blood pressure checkups, making sure if you have diabetes, you're getting your A1C checked. If you have any abnormal heart rhythms, following up with your cardiologist. Managing any, if someone is does like the alcohol, managing, making sure that it's limited. One of the most common things that especially older patients run into is over medication and the drug interactions. So in addition to talking about other things about their care, I always, as a rule, like to review all the medications that my patients are on. And I always also make sure that I ask them any over-the-counter medications, because nowadays all of us take supplements in some shape or form, and those supplements definitely do affect the medications, and the way that they affect it is being, affecting the overall absorption and the efficacy of some medicines, and some supplements do it more than others. So I always want to make sure that what supplements are my patients taking. If someone has any vision issues or hearing issues, to make sure that they have been evaluated for it, and also screening regularly for depression, especially in the society that we live in, where it's more uh, it's more single families, and parents are not living with their kids. We want to make sure that there's no social isolation or other mental health issues. And lately, the awareness about mental health is coming more and more. So we don't want to ignore that part. I'm going to take a pause and see if anyone has any questions.
Hello, Hari. I do have a question if you have the time.
Yes, please.
Namaste, my name is Maha. I apologize for not having my video on. I'm in India currently, actually, very relevantly to this topic, taking care of my dad who's had a respiratory distress syndrome. But anyways, with respect to your slides, if we can go back a couple back, we use the term Alzheimer's and also dementia. Can you clarify if dementia is the umbrella field and Alzheimer's is a kind of dementia, and there's terms like Lewy body and all that? Yeah, that slide, exactly. Thank you. Could you put in perspective how these terms relate to each other, please?
So, dementia, you could put it as the umbrella. That's very correct. And the different types of dementia that I mentioned are, there's Alzheimer's, there's vascular, there could be Lewy body dementia, dementia related to if someone may have Parkinson's. Those are the big ones that we see. If someone has had a big stroke, and after a stroke, if we start seeing a lot of cognitive changes, then they could be classified under vascular dementia. Lewy body dementia is a type of dementia which we commonly see in patients who have Parkinson's, and then they start having cognitive changes. Anyone who's had a long-standing history of alcoholism, and we always want to get that part of the social history, and they develop dementia, it could be we could put it as it's likely related to the alcoholism. And Alzheimer's is a separate type of dementia. So dementia is a big broad term, and then if you're able to find a cause that may have led to them being to having dementia, and if we are able to find that cause, whether it's vascular or Parkinson's or alcoholism or any other, then we're able to kind of subdivide or subname it, or put it as under vascular Alzheimer's or Lewy body. Does that help answer your question?
Yes, absolutely. So did you say vascular Alzheimer's? So would Alzheimer's be
vascular is different and Alzheimer's is different. Vascular is usually seen in patients who have a history of strokes, and after the strokes, if they've had changes in their cognition, then we usually say that it's likely related to their stroke, and then it gets classified under vascular dementia because of the related to their poor blood supply, which led, or circulation issues in their brain.
Okay, that clarifies it. Thank you so much.
So I think coming to exercise, it overall helps decrease our disability, helps preserve independence and maintaining our balance. The studies, the finger studies show that there was a 40% reduced risk of dementia because there was an increase in the gray matter, and the cells, as we aged, they were able to continue with the cell repair process, which is one of the things that gets slowed down as we age. There was, increased cognitive reserve, or which we talked about, like having decreased reserves as we age. So exercise helped with that. And usually they recommend about 30 minutes, each day, or about 150 minutes, exercise each week. This was the general, recommendation. So to answer your question, about the meditation, yes, I think it would help. Are there good studies that I'm aware of that, followed patients closely just with the meditation? I'm not aware of a specific study, but I think in regards to meditation, it helps us have a more balanced, approach, or a mental approach towards issues or challenges in daily life. And I think that would help with the cognitive, maintaining or continuing with our cognitive health as we age. So coming to sleep, they say, the study talked about, having, people, have a set, or try to follow a regular pattern or a regular routine, getting up and sleeping at the same time, avoiding daytime naps. It's more to aligned with the fact that, as we age, with taking naps, I think what it does, it affects our sleep cycle or sleep quality at nighttime. And that's why for aging patients, and specifically for patients who have cognitive impairment, we recommend that, they try to follow as much as possible for caregivers to help them follow a routine, because a routine helps them add some stability to their daily lifestyle. So it avoids the bad or the unpleasant days. But also to understand that despite everything, if someone has cognitive impairment or dementia, despite our best efforts, there are still going to be some bad days and still going to be some, not so pleasant moments. But how to manage those unpleasant moments or bad days. I think we've all seen it, regardless of the fact if you're aging or not. Like if you're sleep deprived, it affects our mood. It affects our overall health. It affects our work quality. So healthy eating. Nowadays, there are different kind of diets. I think you turn a corner and there's a new diet that's in the news nowadays. So I'd like to hear if someone is following a specific diet amongst all of you. One of the most more popularly diets is the DASH diet. It was initially started off by helping patients who had hypertension, helping to manage their blood pressure. But the study noted that it overall reduced the risk of Alzheimer's dementia by 35%. And this diet is mostly it's it's plant-based. It focuses on nuts and vegetables and beans. So it was more of a plant-based diet, which I think is again now in a lot of popularity. I'd want to take a pause over here and see if anyone is following a specific kind of diet and how that has affected them. Or we can, if someone is willing to share, no pressure.
If you can hear me, I just wanted to say that all of these various diets seem to be more of a flavor of the month kind of activity, and we all get drawn to it. I too was at some stage. I think eventually I've come to realize a balanced diet, a little bit of everything, and controlled eating as we age and exercise are the best ways, at least for me and for my family.
Yeah. Thank you for sharing, Ushaji.
You're welcome.
My goal for this year was to, I've had some people who have turned vegan and they talk about the benefits. I don't think I'm at that point yet, but my goal was to have more plant vegetables in my diet and less of animal protein, and then eventually see where I land this year.
Yes, the vegetarian, I mean, the green leafy vegetable and all kind of things in the diet make your stomach lighter.
Yes.
So that's how they become more active, and you become more productive also, and more energetic also, because when your stomach is light, you always feel more energetic.
That's true. You don't have that food slump.
Yeah, when you fry food and everything is like, so with aging, you don't have that much digestion power, and it just stuck there, in the stomach, and you become so lazy.
Yeah. I see Ratna and Rita ji have a question or a comment.
No, that's a comment I was, you asked me.
Okay.
Yeah.
Yeah, even I had a comment here, like for vegan, I'm trying to be vegan as much as possible, except like milk products. Sometimes I end up drinking coffee with milk. So it's hard to completely take it out. But whole of last year, I was a vegan and I could see my energy level was very high. I believed it was because by being vegan, it removes a lot of toxins in the body, the toxins which make you more lethargic or makes you more prone to diseases. So those are removed. So that is the one big advantage I saw from being vegan.
Yeah. And did you have to go through a big lifestyle change when you decided to go vegan last year?
Lifestyle change, meaning I had to get adjusted to eat a lot more fresh vegetables, buy a lot more vegetables, and discipline myself in doing more of those.
Yeah.
That was a lifestyle change. Otherwise, I felt like it was not that hard as I thought it would be. Yeah.
Okay.
But we stayed home. We didn't party more, so it was easier.
Yeah. We'll have to just, I think then you may just have to do more parties after COVID is over, so to help people get into the vegan lifestyle.
True, yeah.
Rita ji, I see your hand is up. I was wondering.
Oh, no.
Okay.
Maybe I can add the comment in this one.
Okay.
Yeah, I agree 100%. I'm doing the same thing, but I'm not that strict like, some people. I have my friend, it says, no, I'm vegan. So they don't eat anything. And I always believe that if you don't eat your, somewhere, if you have to eat your stomach or anything is not going to digest, and it's going to be a big problem. So what I do, like, if I go out somewhere, I'm not that strict, but at my home, I don't make it.
Right.
So, and that really helps me too, So with the digestion problem, I don't have any kind of problem. If I go, definitely will eat less because, you don't feel like to eat like you used to eat before. Your portion is going to be less. But again, your stomach is not going to be like so used to with only one kind of food.
That's true.
You will adjust everywhere.
Yeah. Seema ji, I do see your hand up.
Yeah, namaste. Well, with due respect to all the people who follow, vegan diet, etc., there's no right and wrong about it, but I do think that it is not the product itself which is the problem, the vegan problem, meaning the vegan products like milk, cheese, paneer, whatever, yogurt, right? Historically, since ages, it has been considered in Indian diet as a healthy options. But the issue really is how these vegan products have evolved and being produced in America, which is like a factory production and not a natural production. Yeah. And that's the reason. So the product itself is not an issue. How it is produced in America is an issue, which is now forcing people or whatever to give up the natural product and go for artificially produced products like almond milk, silk, what is it called? Soya milk, and many other, which is multi-billion-dollar industry, So that's all. It's just a comment. Again, with due respect, everybody has preferences, but I believe that if naturally produced milk and homemade paneer with no chemicals, no preservative in it, is any day more healthy than any kind of processed food. So that's what it is.
Yeah. Thank you for sharing your thoughts, and you bring up a very good point. And without being biased towards any of the other cultures, I feel all of us coming from India, our culture and our diet gives us so many options that everyone can adapt and it into their individual lifestyles and make it work. I think that's the beauty of of Indian food. So going back to our discussion, again continuing along on the same topic of socializing and learning. When we socialize, it helps us build meaningful relationships long term with friends, with neighbors. Learning, acquiring any learning a new language, a new skill. What that does for our brain is it helps activate memory, reasoning. So it's a way of working the brain. That's why you always see people saying that they're going to learn a new skill, they're going to learn painting, or they're going to learn a musical instrument. So just different ways of getting your brain to work, and do its part, its share of exercise. Preventing injury, preventing falls, making sure that we are evaluated regularly and are able to drive safely, being watchful of infections, and something to that we may see, especially in older patients, which is called as delirium. Delirium is a waxing and waning of our mental alertedness. So if someone has an infection, especially if they're older patients, you may see that because of the infection they may have a period where they're very confused for a certain number of days or a certain part of the day, and then the rest of the day they're very lucid, they can have a good conversation, they're not confused at all. And this is what is called as delirium, which we see very commonly in especially older patients. And then again, going back to my point, when someone is in the when an older patient is in the hospital for whatever reason and they've been hospitalized for quite some time, if as a physician I'm seeing that there's some confusion, and the family sometimes thinks, oh, is this the onset of dementia? That's when I take some time to educate them that if there were no warning signs or red flags before they got hospitalized or before they had this triggering event that made them come to the hospital, more than likely it's delirium. And before we actually go ahead and say that, oh, this patient has dementia, we want them to give their body a chance to heal and recover and see if the confusion resolves. Because for as simple as it may just be delirium and it may not be dementia. So being very mindful of, where and on whom we use the word dementia, because sometimes as physicians, and I think I take responsibility for that, that sometimes when physicians use a term loosely, families associate that, that term for their loved ones. And I try to be very cautious of when I'm actually using the word dementia for my patients. And in those circumstances, I may say that there is concern of cognitive impairment, but I would not use the term dementia. So just to kind of get an overview of what the risk factors are, like we talked about, any heart-related diseases, diabetes, which affects, different major organs in different ways, strokes, mental health-related issues like depression, any brain-related injuries, either traumatic or it could have been, related to strokes, some medications. All the medications that we take don't come without side effects. So we always want to make sure that the medicines that we are on, they're evaluated regularly, their doses are the right ones. So having, that discussion with your doctors on an ongoing regular basis, should be part of your annual physical exam. Poor diets, excess of anything like we talked about, excess of alcohol or smoking, sleep problems, and little social activity of being alone. So all of these are big risk factors which could overall affect the cognitive health for all of us as we age. And to summarize it, healthy aging will start with healthy behaviors earlier in life, and trying to make small changes that we can incorporate into our lifestyle without going taking extreme measures. So this I think is a good visual picture which kind of helps us if I had to divide, our lifespan into 3 phases. So the phase 1 is where we have the opportunity to, to be able to follow a healthy lifestyle, adopt good, habits, so that, we are trying to prevent any chronic diseases. In a stage where we do eventually end up with some kind of chronic disease related to the heart, lungs, or kidneys, that is kind of is a start of some problems and how we can best manage it. Again, with having regular follow-up with our physicians, managing our medications, and ongoing lifestyle changes to best manage the chronic problems or the chronic diseases we may have. When these diseases are not managed well, we end up in acute crisis situations, either getting hospitalized or emergency rooms, and or frequent doctor's visits, and leading to a physical decline. When that eventually progresses, we start seeing changes, especially for the older population, when they are no longer able to manage in their home. They're needing extra care, going to nursing homes or facilities where they can provide 24/7 care. And that's when we kind of getting to a stage of making hard decisions and what one would want at the end of their life. So this is a toolkit, I think, which applies to all of us, regardless of whatever stage we are in our life right now. Talking about home safety, proactively planning for our care, making sure that our financial and legal matters, the ones that need to be in place, those are taken care of. And through all of this, continuing to trying to manage our health with screening, with regular exercise and nutrition, making sure of having a good community support, social engagement, medications that we need to if we are on any, if you have any chronic diseases. So these were some of the links for where I gathered my information from. There are some books at the bottom. I'm sure everyone has heard about the book by Dr. one day. It's Being Mortal. I've read this one. I haven't read the others. I have read a little bit of about the 36-hour a day. It gives good information, especially for caregivers who are taking care of patients or their loved ones who have dementia. I haven't read the others, but if someone has, I'd like to get their input on it. So this slide talks more about how we can support families who are taking care of their loved ones who have dementia, making sure that any reversible causes that someone might have from dementia, with the dementia, like infections, are the big ones that we see in dementia patients. Neuropsych testing that we talked about, learning, there are a lot of support groups for dementia. Overall, working on a daily schedule, making sure that the home is safety proof, helping with, resources for like adult daycare centers or senior centers, making sure, they have, a legal power of attorney, they have a medical surrogate decision maker, making, their affairs or their finances are in order, and doing this early at the onset of the diagnosis, and helping the family or the spouse plan to help with caregiver. Because I think being a caregiver for, a family member who has dementia, it takes a big toll. And the goal is, to try and support them through this process. What I mentioned earlier, anyone who has dementia, the goal is to overall have more good days and less bad days or rough days. Some of the things to follow is having a daily structure, calm environment, and avoiding triggers. If they get fixated on something, to agree and try to redirect, but not try to, say no and disagree, because that will just trigger the whole situation. Making sure they have their safety, issues have been addressed at home. And again, simple things like, photographs, music, reminiscence, where, you talk about old and good memories. Those are really good therapies in their overall mental health for patients who have dementia. So those are some of the things that we try to do. That is the end of my presentation, and I'd like to hear comments or questions that everyone has.
I can go, although I did not raise my hand, but I can wait as well.
Quick question, should we be taking down notes, or will this presentation and the links and all of that will be shared with us later?
This is all being recorded, Ushaji, so you should be able to follow the recording again whenever you want to.
Oh, awesome, because you had some good links and I couldn't take them all down.
Okay.
The files should also be available to you on Moodle, so you can examine these presentations at your leisure later on too.
Awesome, thank you so much.
All these presentations are already there on the Moodle, but if you want to read the recording, you can go over the recording on the once it's uploaded.
Okay. Can I stop sharing the screen, Mukundji?
Yeah, that's fine. Okay.
It's very, very good, very simple way you explain, and it makes very clear. You are excellent. So proud.
Thank you for
your Thank you all. I think we are a little behind the time schedule, like we are 10 minutes behind, but I will let you all take a 5 minutes break. Once we come back, we will start with Mukundji's presentation for Aging 300, followed by this. I'll put up the lesson plan for that right now. And if you have any questions.
I can try and make make up for the time, so no worries.
Sure. Okay.
And perhaps just to save time, since the lesson plans are already up in Moodle,
yeah,
let's not talk about that. You can just go directly into the lectures.
Sure. Yeah.
I just
had a question.
Yes, Nishtaji.
Hanji, I wanted to ask you, I actually volunteered with the Alzheimer's Association here, and I work, and I also volunteer with the Indian senior citizens in this area. And I wanted to know how difficult, I mean, I don't know if up north you guys have it or not, but how difficult is it to get funding, to get some housing approved for senior citizens? Like, you know, the Chinese community has a whole community here, and it's only for their senior citizens. How difficult is it to create something like that? And the other comment that you made about music and so on, it's very, very helpful to do music as well as art. And I will post in that WhatsApp group a movie that was done. It's amazing. I've been trying to find somebody to translate it into Hindi or Gujarati or some of the other languages, and it's very difficult. But they do show how the Alzheimer's, you know, these different triggers and cues for the family to watch out for. So I will post that in the WhatsApp group. But if you could just answer if you guys have done anything up north with any senior housing for the Indian community?
You know, I'm not aware of this. There's some community, you know, housing projects for our Indian aging population. Unless Mukundji, you have something to add, honestly, not that I know of.
There have been a couple of efforts to do that for Indian-based families, but nothing really has materialized yet. It's primarily economics and other considerations that have thwarted that.
Yeah,
but I think Florida and New Jersey, they do have it, but for some reason, I don't know, California, we've not been able to do anything like that, which it would be awesome if we could, you know, maybe put together our minds and do something like that. It's a great need.
Perhaps we can talk about this at the end of the session if we have time.
Yes, sorry.
Yeah.
So everybody, let's resume the class at 2:35. If everybody's okay with that.
Yes.
Okay.
Anitaji, can you stop sharing your screen?
Yeah, I will stop sharing my screen.
Thank you.
You know, I just wanted to share one small story before I say bye to all of you. This is early when I just moved to the US, and I was doing my residency training in Chicago. And I had gone to a Macy's store in Chicago with my aunt and uncle. They both are physicians, and they really wanted me to meet this person. And this was a 92-year-old lady. Her name was Nora. This was back in 2009. She was working at Macy's and she was a saleswoman.
Oh, wow.
And she was sharp as a tack. She was so well dressed, and she was so she was so pleasant and, you know, very interactive, and you know, that left a very you know, big impression on me. And I was like, okay, I hope I get close to of what she is, at least half of what she is. But she was amazing, and at 92 she was working full time.
Yeah.
That's a wonderful story that we can all aspire to reach for, right, Rakiji?
Yes, and you know, it does, you know, do it in our own little ways. It doesn't have to be like Nora.
Thanks again on behalf of all of us for a wonderful lecture and a stimulating discussion from you, Rakiji, as always.
Thank you.
Thank you.
Thank you. Bye.
Thank you. Have a wonderful day, Rakiji. Thank you.
Bye.
See you again.
Thank you very much.
Bye. Thank you.
Thank you. Thank you very much, Rakiji.
while we are waiting for the class to start, Mukundji, could I ask you, you referred to something called a noodle or Moodle. I don't think, I don't know what you're talking about or where I should look for it. I'm only part of the HCI WhatsApp Curiosity 60 group. Is there some other place I need to be looking at?
So what I was talking about is there's a way that I guess in the first class, there's a learning management system or LMS that we call Moodle for short. And there's a way that you can, all the presentations and reference materials for every lecture that you've heard so far, you can go and look at they'll be loaded online and you can go and extract those. If I'm guessing that you were told how to do this early on in the course, and that's what I was referring to.
Okay, my apologies. I don't think I'm part of this course that you're talking about. I'm part of the HCI 60+ Curiosity WhatsApp group. And that's how I got to know about this presentation, and it's been very, very good. And I'm so glad that Kailashji posted it there also. But if there is something else that's going on, or
I understand. So if there are specific presentations or things that you want to refer to, then let one of us know, and then we can figure out how to get access to you for that. So I'll talk to Kailashji offline and figure that out.
Yeah, thank you. But where are these courses being held? I guess I don't have enough of a background.
Well, this is part of HCI's Counselor of Hindu Tradition program. And so this is a course that's held over 9 months, 24 sessions.
Oh, so it's part of that. Okay.
It's part of a regular course, and you've been invited to listen to it today.
Oh, I feel very blessed, and thank you so much, Kailashji, for having posted it in the HCI group, WhatsApp group. And thank you, Mukundji. I've heard your name and I've seen a lot of your presentations and talks. I'm very, very impressed with your wisdom. So I feel very blessed to be part of this session today.
I'm humbled and grateful. Thank you.
Welcome back, everyone. Hope everybody's back.
So could we just, with a quick turn on of video screens, just let us know that you're all back? Cool. I think some of them may still be away. So we'll give it a couple more minutes and then get started, okay?
Okay.
Yeah, people are coming back, good. And I'll try and make up time. So we'll give you your Sunday back at the proper. If Mahaji is in India, she must be up in the middle of the night.
Yeah, that's what I was saying, like to her on this text side note.
Yes, yes. Thank you, Mukunji, for remembering. It's 4 now, but I started around 2 a.m. But it
2
worked
a.m.
well. It worked well, ironically, because my sister and I are taking night shifts, taking care of my dad, and I start at 2 a.m.
Oh, wow.
Going forward. So, and these last couple of days, it's been a bit quieter. So I decided I'll join you guys. Thank you.
Well, Mahaji, you are doing, I guess, service of the heart and the mind, looking after parents. There's no greater honor sometimes to be able to do that. And
yeah, I do.
these courses are little, hopefully a nugget here and there that will ask.
Thank you, Mukunji. I do feel it's a blessing, as ironical as it may sound. It is a hard place to be, but grateful for the progress he has made so far.
Wonderful.
That's one of the things I'll be talking about.
Yes, thank you. And when I saw all the topics, I felt like it was just geared mainly for me. I also have a father-in-law very close by whom I've just visited only twice, and I have feelings of guilt for sure. And he has been showing signs of, now that I understand, cognitive, I don't know what you call it, cognitive failure. And I loosely used the word dementia yesterday with my son, and the first question he asked was, has a healthcare professional said that, Mom? And today, Dr. Rakiji pointed the same thing. So I'm so grateful for this opportunity.
Okay, thank you. So I think I'll get going in the interest of time. And if people haven't joined, they can catch up. So we just heard Rakiji talk about cognitive vitality and dementia and what it is not, what we can do about it, and so on. And you'll find several of the themes that she, can you all hear me properly?
Yes.
Yeah, good. So you'll find several of the themes that she addressed will flow into this lecture, into the next lecture, and so on. So there's a lot of commonality and overlap of these topics, as you'll find out. So in the next 30, 40 minutes, I'm going to address what we call elder care and geriatrics, and I'll go through and define those terms. And the objective here is...
Sorry, Mukundji, there is some rubbing noise. If nobody else is speaking, maybe you can put it on mute. And yeah.
Thank you.
Thank you.
So I'll start out by talking about the objectives of the course today. First, we'll talk about geriatrics, and there are also a couple of other terms, related terms, that I'll define to you in elder care. So give you an overview of what that is. So when you hear people talk about this, you understand what they're referring to. And then describe ways to approach and deal with these issues when we're caring for our aging family members, as Mahaji is doing right now, and as I had the privilege to do for my father very many years ago. And as I mentioned, was there a question? I think I saw a hand raised. I guess not. Perhaps if you have questions, maybe you can note those down, unless it's important to understand what it is, and then we can discuss it at the end of the class. Maybe that'll make things go a little faster. So as I mentioned, when we talk about aging, the role of the caregiver is sort of almost inherent in you can't talk about one without the other. So talk about that and where we are with the caregiver role today. And then hopefully by the end of this coverage, we'll leave you with a body of knowledge and understanding, or at least a first glimpse, but you can go back and review material to understand things better, an understanding of the fundamentals of these topics so that you can address them in your own friend circle, with your families, and also the main reason that you're with the CHT program as to how you can utilize this information as you go forward and do community service. Okay. And at the end, I'll provide you a list of resources that you can go back, links that you can go back and read more about. We'll barely graze the topic in the time we have. And so depending on your interest, there's a lot more you can do in terms of learning and reading. Okay. So let me start out with a bunch of facts. The National Alliance of Caregiving in the US and the AARP organization, every 5 years, they put out a research report on caregiving in the US. And this report came out, this latest one, about a year and a half ago in May of 2020. And I've taken some of the data that I'm going to show you from this and some from the Alzheimer's Association and so on. The facts are that there are almost 53 million people in the US today, I'm not looking at the whole world, who are primary caregivers for people, primarily older people, adults, but also some children who have disabilities, individuals who are recovering from surgeries and illnesses, and those coping with Alzheimer's and other chronic diseases. So you could either have an acute disease, overcome it completely and get back to quote unquote normal before, or you're dealing with, you're in a situation where you have to deal with something that's chronic, it's lifelong, and sometimes it's chronic and progressive, so it keeps getting worse in the sense that it reduces your abilities as you go along in the time you have left. And so you need people to help you. You need people who can care for you. The sad part of it is this: many of the caregivers are themselves aging or elderly. A very typical situation is a husband and wife, spouses living, one is caring for the other, or sometimes they care for each other the best way they can. And this has come to no surprise to any of you here. Most of the caregivers are primarily women, and data collected by these organizations show that they provide an enormous amount of time annually in unpaid care, and the amount of money that converts to in terms of an economic activity, gross domestic product, I think I'll show you in a later slide, is almost like $500 billion a year. A lot of adults are caring for adult children, so-called the sandwich generation, if you will, are caring for children, parents as they as they've grown old, while bringing up their own children. 10,000 people turn 65 every day in the US. So the population of senior citizens is growing in leaps and bounds. And there are almost 1,750,000 adults who live with a disability like autism, right? And they live with parents or another family member who's themselves almost a senior. So aging and caregiving kind of become inextricably mixed after a while. And so then you ask yourself, for the people who are being cared for, what happens if that caregiver was to go away somewhere? How do you prepare for that? How do you plan for that, right? So that's one of the things we want to be talking about and thinking about. Now, we've talked about Alzheimer's quite a bit in Dr. Rakhi's lecture, but a few topics to discuss here. Dementia, as she mentioned, is an umbrella term for a bunch of symptoms that are related to cognitive decline and the inability of us to handle our daily activities of living. Alzheimer's, currently is expected to triple by 2020 from where it is today. 4.7 million patients in 2010, about 6 million living with it today in the US, and expected to go to almost 14 million by 2050. So you can see that the numbers of people who are dealing with Alzheimer's in a population that is aging is increasing, which is no surprise, but the numbers are quite staggering in their own right. And this is not counting other illnesses, chronic illnesses like heart disease, and so on and so forth. According to the CDC, Alzheimer's is the 6th leading cause of death in the US. And I'll talk about more about the impact through the pandemic in a little bit. Okay. And so when you look at the population that's older than 70 in this country, about 15%, a pretty large number when you think about it, has dementia. And some numbers, I've read some statistics that say that in the population that's over 90 years old, there's close to 50% chance of some level of dementia in patients. So the older you are, the more likely it is that you have some form of dementia in whatever level of seriousness that it has. Okay. I'm going to give you quickly some data that Alzheimer's Association just released about 3 or 4 months ago in a special report that I can give you a link to if you're interested later on. As I mentioned, more than 6 million people are currently living with Alzheimer's in the US today. But what is surprising is that over the past 2 years and through the pandemic, diseases related to dementia and Alzheimer's have increased 16%, which is much higher than deaths, of course, leaving deaths due to COVID aside, much higher than deaths due to other illnesses. Right? 1 in 3 of people who are over 65 is going to die with cause related to either Alzheimer's or some other form of a illness leading to dementia. While we've made progress on the medical front, for example, between 2000 and 2019, deaths due to heart disease have decreased almost 7.5%. During the same time, deaths from Alzheimer's have increased 145%. So you can see clearly that this is becoming a societal problem in addition to a problem for individuals and families. In fact, now they say that it kills more people every year than breast cancer and prostate cancer combined. And it costs money, right? Whenever we have illnesses of these, it costs society money, it costs us healthcare money, and so on. It cost the nation $350 billion last year. It's going to be more this year. And they estimate in another 20, 30 years, it's going to increase $1 trillion in terms of cost for looking after the care for people with Alzheimer's. Okay. And as I mentioned, there are a lot of caregivers. Most of them are unpaid. Almost all of them are unpaid, right? Majority of them. Over 11 million Americans provide care for people living with Alzheimer's. This is of the 53 million that I talked about who are caregivers. And they provide an estimated 15.3 billion hours every year, valued at $257 billion. Okay. So clearly, we have reached a crisis of aging and caregiving where we need more people, we need more help, we need assistance of different kinds. There's a growing need of growing population that needs full-time 24-hour personal care. As Mahaji is mentioning, family members take shifts to make sure there's 24-hour coverage. Right? In the US, they estimate that there's one specialist for a disease for every 20,000 older adults living with severe chronic illness. We'll talk about palliative care and hospice care in a separate lecture, and I'll tell you exactly what those mean in the May-June timeframe towards the end of the program. But there are only 1,600 hospital teams across all of US that provide palliative and hospice care. A severe shortage of that medical specialty that we'll describe later. And there are only 18,000 physicians like Rakiji, who you just met, and like Neeluji, another Sukham colleague who you'll meet later, who are palliative care physicians. There are only 18,000 in the country. So there's a need in this country, not only for specialists of different kinds, medical specialists, but also for trained amateurs like you and me who can provide effective caregiving. So this topic of caregiving and aging is very relevant to anybody who's thinking of doing community service, and also for just general knowledge in the society that we live in. Okay, so with that, I want to cover the topics that elder care. Yes, Sangeetji, you had a question. Sangeetji? Perhaps not. Perhaps I just misunderstood. Sorry. I'm going to define three terms: gerontology and geriatrics, and one more term, and then put that in context. So when we talk about aging and elder care, there's a science that studies the social impact, the psychological impact, cognition, as well as the biology. So in addition to the medical aspects of aging, all the other issues that impact society and the way we live and work with each other is covered under the science of gerontology. Geriatrics is sort of a complementary medical specialization to pediatrics. So geriatrics is the branch of medicine that's specialized in older adults as opposed to young children. And I know many medical doctors will say, I would rather not answer this question. I don't think I'm qualified. Go see a geriatrician or go see a pediatrician. They can help, because branches of medicine are becoming more so specialized that you almost need to go consult a specialist in getting old, which is what geriatrics is, right? So that's a branch that's growing. There's a third term that is important to us as the Indian South Asian diaspora who live in this country, and that is gerodiversity. And this term suggests to us that our cultural heritage, our social structure, our traditions, our language, the way we live is a very important thing to consider as we consider our issues of aging as we grow up. Okay, so the gerodiversity, the study of gerodiversity is a multicultural approach to study the issues of aging. And so it provides the basis for which the medical and the psychological, the neurological, and other medical specialists treat adults, because they have to understand the system in which we live. They have to understand our ecosystem, which includes not just where we live, which city, and so on, but our cultural identity, our heritage, the way we interact with people, what our social environment is, which communities do we live in, how does family play a role in how we live and work, and what our significant relationships are between one another. So understanding the holistic nature of a person, of a family, and how they live is essential to provide the proper treatment and the proper recommendations for treatment as we grow older. So the science of gerodiversity is going to become increasingly important in a globalized world such as ours. Okay. I'm going to spend a little bit of time now talking about a few issues of growing older. And these are can be listed in about 8 or 10 what are called principles of geriatrics that were developed by a hospital system in Atlanta. I believe it was the Ebony Hospital System. And essentially, they say the first thing we have to understand is that aging is not a disease. Aging occurs at different rates from one individual to other. And even within me as a person, different parts of my body, different organs may be aging at different times. Aging alone does not cause symptoms. Aging increases susceptibility to many diseases, but at any given age, pick a number, 75 years old, you find people who are very ill and people who are very ill, very well. So aging is influenced by a variety of different things: environment, genes, lifestyle, access to what's needed for healthy living, access to what's needed for socialization, access to what is needed for companionship, and so on and so forth, right? As we grow older, we don't, when we fall ill or when we develop conditions, we don't just have one thing going on. Typically, for a senior who's unwell, there are 6 different conditions that they're being treated for. And these medical conditions are they can be chronic, meaning it's long lasting. It can be acute. It can be very serious for a while and then completely go away. There's multiple things happening at once and multifactorial things, meaning what happens for one ailment and how you treat it impacts the other ailment. And there's the interaction that Rakiji mentioned that happens, right? And I discussed this in my first talk on healthy aging. The goal of geriatrics is to maximize the quality of life of a person and the functional ability of a person. How best can you make an older person who's unwell function the best way she or he can? How can you maximize her quality of life or his quality of life the best way? So that's one of the driving forces of geriatrics, right? This is the other sad part, is that many people either don't have access to medical care or ignore what's going on until it gets too late, to a point where conditions that are completely reversible and treatable are often either underdiagnosed or undiagnosed or not treated to the extent that they could be. So geriatricians want to correct that. And as I mentioned with the gerodiversity, our social history and support and the preferences of the patients, what do they define by quality of life for themselves, are essential aspects of managing patients. There is no one size fits all in this case. Right? We've already talked about this in Rakhiji's talk. Cognitive and affective disorders are quite prevalent, and quite frequently we don't know about it. We don't notice them until they're progressed sufficiently. Iatrogenic illnesses, and this is a term that derives from when a doctor tries to treat us for something, they cause some other condition, right? The most common definition of most common example of this is interaction of one medication with another. So these illnesses that derive from the attempt to treat us are quite common. Many are preventable. There is no one specialty that helps treat older people. It's multidisciplinary. You require therapists, you require doctors, you require social workers, you require dietitians, psychologists, and so on and so forth. And it can be provided in a variety of settings, from being at home to having to be admitted to long-term care, depending on what the patient has. And again, especially as when they grow older and maybe they have dementia or no longer able to advocate for themselves, ethical issues and end-of-life care become critical aspects of the practice of geriatrics. Pointed to some of this. This field of elder care is crisis-driven. It's not something that you do on a daily basis. You don't go to a doctor unless you're unwell. Sometimes you don't go to the doctor even when you feel unwell because you feel there are other priorities that you have. But the message that I want to convey to you is that to the extent that you can avoid reacting only in a crisis, to the extent that you can start early and plan ahead, your quality of life and the impact on your family and your friends can be minimized and your quality of life can be maximized. So organize your thoughts, organize your actions, start early, and understand that things can change very rapidly in a situation when in this. The next part of this talk, so that kind of gives you a background. The next part of this talk, I'm going to be giving you some tips on what are the things you can do so that you can provide the best care for the older person. And this is now a focus on the person receiving the care, right? We'll talk about on the caregiver in the next talk. So think of a number of different things. The safety. How do you coordinate the care across 2 or 3 disciplines, across 2 or 3 illnesses, 2 or 3 different doctors, specialists, and so on? Not all people have a primary care physician who looks at all these aspects and does the coordinating for them. People just sometimes frequently just go from one specialist to the other, and the exchange of medical information isn't always perfect. So we need to be advocating for ourselves and for our family and making sure our care is being coordinated correctly. Think of what's of value for that person in their daily life and maximize that functionality, maximize that quality of life the best you can. We've talked about diet in the last talk. Think about the diet, think about their hygiene. Are they able to take care of themselves well? What help, what assistance do they need? Do they have memory issues? How can you assist with them with that? What are the memory aids you can provide them? What assistance do they need? And so on. Are they able to move around the house? Do they need a walker? Do they need help driving from point A to point B? What sort of help do we need in terms of maximizing their mobility for the life that they need to live, right? And then we need to learn about different things. There are 2 terms that you will see people use in the profession. One is called ADL and one is called IADL, activities of daily living, and instrumental activities of daily living. Very simple to understand. Activities of daily living are all the things you and I do to look after ourselves every day. We get up in the morning, brush our teeth, take a shower, change our clothes. If we need to, we can cook our own meals, take care of ourselves. What are all the things we need to do to look after myself? Those are my activities of daily living. The instrumental activities of daily living are the activities one needs to do not to look after oneself, but to live in the community. So make appointments, make phone calls, drive, go to a bank, write a check. All of the things that you need to do as functional members of society are called instrumental activities daily living. So people are categorized in their ability, in their functionality by how do they perform an ADL, how do they perform an IADL, when and where do they need help on one or both. So you need to be familiar with that way of thinking about things. Then in this kind of a society, you need to understand whatever medical and other insurance coverage people have, life insurance, long-term healthcare insurance, whatever it is. Understand the finance as well. Rakiji talked about finances as a critical part of looking after those with dementia. If you had to pay for care, a nurse or a aide or a nanny or somebody to come help for a few hours, what does that cost in your community? What supportive resources and groups are available in your community? Be aware about that beforehand so that you're not responding to a crisis when it happens. Plan for your family yourself. Set up a network of care so that we know for each other what are the things we need to do when the time comes, right? I for one want to live in my own house independently as long as I can. But what happens when I'm no longer able to do IADL or ADL? What happens to my housing then? What are my options? Who will take care of my finances for me? What are the financial, legal, etc.? How are things going to be paid for? Does my insurance cover everything? Do I need to borrow money from my retirement or savings funds to cover things? What are the options, right? Those are things we need to understand. Then look at the system of care in your community. What are the hospital systems? Where are the emergency rooms? What are the rehab centers? Is hospice and palliative care available? Just understanding that community and knowing where the resources are going to be, it's helpful to plan ahead and think about all of these things, right? And we as Indians, South Asians, typically don't like to do this. We're very private people. We don't want to talk about our issues, but at least within a small core group of family or maybe friends, have meetings, discuss these things so we're all on the same boat. It really works well rather than having to do it in a crisis situation. A lot of us are dealing with adult children. A lot of us are dealing with adult parents. A lot of us are dealing with young children. And with this family construct, there's a lot of juggling you have to do with your work, your activities of daily, your own activities, daily living, your friendships, your extracurricular activities, when you have caregiving and other issues thrown in. So sometimes you have to deal with role reversal. You have to, it's like this little cartoon on the right, you're juggling several balls in the air. What do I do next? Should I look after my spouse, my kids, etc.? Sometimes there's a lack of common ground within the family. You don't all think alike on certain things, right? So it helps to have a discussion. It helps to figure out having a coordination plan and on tips on dealing with the medical system, where a variety of other things that would help you when you have this elder care issue that you have to deal with, if you've got a plan in place to work it, right? Understand what the challenges of the system are in your community in terms of staying well, in terms of preventative care, in terms of dealing with illness. And I've talked about these, the clinics, the hospitals, the facilities, and so on. And there may be issues in your area where there are gaps in the system. So how do you, if you had to deal with this, how would you propose to do it? So understand what the potential challenges are in the system. Right? Okay. And so here's a list of proactive planning areas. We've addressed some of these in more detail. Some of these are lectures by themselves, but understanding the health condition, the safety aspects, housing, having a transition plan for housing if needed, right? Legal and financial issues, getting a good grasp of all the resources you can energize and bring in on your behalf, and a good um, support within your own community are all the some of the things that you might want to address. All of you may not have all of these issues. Some of you may have to pick one or two or three of these areas and do some more detailed planning. But this generally is a list that professionals suggest that when you're dealing with old age, be aware of all these things and plan for them. Okay. I'm going to be talking about caregivers more in the next lecture, but you have to understand that within a family circle, anyone can be or anyone can become a caregiver, right? You can be a patient, you can be a caregiver, the roles can be reversed. And it can be within the house, it can be for a couple of weeks in a hospital, it can be for rehab, it can go all the way to end of life, looking after a person until he or she passes away. And the different people play different roles. So being ready for these transitions is important, and I'll talk about this more in the next lecture. Okay. This is again a topic that I will leave for more discussion, but look at this from the point of view of the patient. A patient has to understand that caregiver has to deal with stress as well. Did they make a choice to be the caregiver, or was it a de facto thing, right? How can I, as a patient, given all the things I'm dealing with, if I'm able to, how can I relieve that caregiver of the burden and be supportive of the person looking after me? What are the family support and dynamics that I can, if I'm able to bring to bear to help the person looking after me? So those are again some of the questions that we want to think about and address, right? I talk about this in terms of caregivers, but this applies to both the caregiver and the patient. You have to know about yourself, what your goal in life is, how you respond to day-to-day situations. Are you focused on the task, or do you want to avoid confrontation? Are you worried more about maintaining happiness around you? You know, what drives you? Understanding how you behave will help you then in turn provide the best care to other people, right? And all of these questions, we know each other if we've lived as a family together for many years, but all of these questions sometimes are not discussed amongst one another, and that creates conflict. And conflict is one of the things we want to avoid when we're looking after someone who needs our help. So these are some of the tools that we can think about in terms of listing for ourselves and learning to understand how to maximize the situation for everybody concerned. Okay. Rakiji talked about this to some extent. We have to be proactive in maintaining both our physical and mental health. She listed several different factors: diet, exercise, social construct, etc., etc., etc. The Center for Disease Control has a number of detailed references that help you develop your own checklist and develop your own routine to maximize your health. And as I'll talk about it in the next lecture, while we're talking about this in this construct for people growing old and being unwell, it's important for the caregivers as well, right? Here are some links that I have for that have resources on elder care. Avenidas is a local organization in the Bay Area that have a number of excellent resources. The National Institute of Aging is a federal government institution that has some excellent resources. For the Family Caregiver Alliance and Elder Care Locator and Lots of Helping Hands are community service organizations that have a national footprint. And then locally here in the Bay Area, the Stanford Hospital has an aging adult services program that provides help in a variety of different ways for elder care. So here are some of the resources which might help you if you want to go further down the journey to understand this some more. Okay, and again, there are some links in the document that I can that I'll leave with you. You can look at these at your leisure. And with that, I will stop share, and I'm open for questions. How am I doing on time? Any questions, any comments, any thoughts? Floor is open. Rita ji?
Yes, how can we find out about the private care and community supportive things? And you gave for the Bay Center, right? But all over in United States,
Right.
Is there any special things like for nationwide or things like that?
There are some couple of the links that I gave you in the document, like the elder care locator and so on.
Yeah,
you can actually enter a zip code.
Uh-huh.
And based on that zip code, they will give you resources. Usually the county that you live in has a county elder care services. That's an excellent resource that you can start with as well. But talking to if you're within your healthcare system, your primary care physician or a specialist is sometimes a very good person to contact to say, give me some links or references in the community to go for the specific things that you're interested in. But I would say if you start with those 2 or 3 things, you will then very quickly get more information on what your specific needs are. And if you have looking for specific information, you know, if you sort of send me a text privately, then I can try and see if I can find someone in your area to help you with that as well.
Thank you so much.
Seemaji?
Yeah, namaste everyone. I just wanted to share some information based on which was raised in a previous session. That there is definitely shortage of resources for aging population specific to Indian community. The needs of Indian community are different, but there are few out there. For example, Priya Living Senior Services in California, they have 2 locations which are tailored for Indian community. And then I believe last year in Washington, D.C. metro area, the former president of Seva International has opened a daycare for seniors where a working couple can drop their senior parents where they can socialize and during the daytime, just like daycare for children, and they can drop them and then pick them. So they don't have, while they're at work, they don't have to worry about their whatever food or other needs or being lonely or something like that. So I just wanted to share these 2 points. One is a couple of resources which I am aware of, and there's definitely a need and shortage of some, you know, resources or housing which caters to Indian community needs, because there are obviously cultural differences, and the local senior care centers do not cater to Indian community need with respect to food, culture, other issues. And of course, they are phenomenally expensive also. So
that's right. A couple of comments, Seemaji. Thank you for that. So in the Bay Area here, you have the India Community Center that also runs a couple of senior centers, 2 or 3 now, in fact, in different parts of the Bay Area. But of course, with the pandemic, all those activities have temporarily come to a stop. There also were a couple of efforts to have enough people come together to actually build a senior community for Indians, but for financial and other reasons, that. So you're definitely right. For people looking for that sort of arrangement, there is a lack. So I guess the question we have to ask ourselves is, in the next 5, 10, 15 years, if that's not there, what's the best thing we can do? How can we as a community adjust and support each other? Are there ways of building groups within our own local communities that can manage to do that? So there's a lot of discussion and activity that needs to happen at that level. And maybe that's one of the things some of you as community service can think of in your community going forward later on in the next few years. Take an active role in leading that effort to help bring some level of commonality that includes our culture, our heritage as much as possible. Those are some of my thoughts.
yeah, can I make a counter comment?
Sure.
Yeah, so Mukundji, I know that you mentioned about financial constraints, which are, you can say, prohibiting such initiatives. But I mean, with due respects, Indian community is one of the most successful community, and people have plenty of money. So I don't know about that, and especially in Bay Area. So it's, and I mean, I am aware of people who have like hundreds of properties out here, within the hands of few people, so it's just like, it's called redirecting the resources properly, so, or maybe, I don't know, whether they don't see the value in it, or they don't have lack of interest. It could be anything, the only challenging part is this whole insurance issue in America, the liability factor, but other than that, I do think Indian community has lots of, is a wealthy community, in my opinion, so.
It is. There are, as you said, some very, very wealthy people, but I also know personally several Indian families who are having difficulty making ends meet. So it's the diversity of the Indian community in terms of socioeconomic status has, at least in the last 10-15 years, changed quite a bit all over. But that's a discussion of its own, Seemaji. But your point
Right.
Yes.
Yes.
How are we doing on time, Anita ji?
We are just 5 minutes behind.
So are there any recent experiences that you know of that you would want to share with the group that that touch upon the topics that we've discussed? that would point to, for example, the lack of, if you, in retrospect, if one had planned a little better, things might have worked out better. Any such experiences that one would like to share? Rita ji?
Oh, yes. I was just thinking, I think Srimaji said, right, about that Indian community has lots of money. Last year, I met one of the guy and he was working for IBM, very good position, good money making and everything. And they took the early retirement, and then the sickness comes, in the both of the family. It's lots of hospitalization and lots of expense, and they have to take out the money from their pockets and all kind of things. And they are very broke. I heard from a couple of people. And maybe the way you said, maybe it's a poor management you can call, or I have no idea their situation, what they were doing and how they were planning. But sometimes the way they were talking and what I heard, all other expenses, like, after they get retired, all the hospitalization on and off, both husband and wife and everything. So they got drained up with the money.
Yep.
Major sickness drain you up, no matter how much money you have and everything. But sometimes that's what they were telling.
Yes, if you don't have the right kind of health insurance, it can put you in financial trouble. You're correct. Nishta ji, you had a comment or a question?
I actually had a comment and I was going to share. As I mentioned, I volunteer with a couple of Indian senior groups here. And one of the things which keeps on coming up is the loneliness that they all feel. And I had sent you a message offline regarding that. So what we're trying to do, because I looked at some of the other non-Desi groups, so what we're trying to do is set up some sort of a check-in phone call to these seniors, and just to, just communicate with them, talk to them about different things, and just have them feel a little less isolated. So I think it would be great if we had something like this at a larger scale, where the person who's calling could talk in Hindi, in Gujarati, or in some of the other languages which are most prevalent, and just and even get some of the younger seniors to make the phone calls, but just do a health check-in. It's called, I think it's called a wellness check-in, and it's a phone. You basically are calling like 10 people and making sure that all is well, because they feel less isolated. And if there's some seniors here who have no kids. It's just the husband and wife. In one case, the wife has got Alzheimer's, so the husband feels really isolated. So I think that would be a great initiative to do even nationwide, where we had volunteers who speak the various languages.
I couldn't agree with you more. Yeah, that would be a very valuable service. Thank you for that. Imaji?
Dr. Mukund, if I can share.
Yeah, I just wanted to add to what Nishtaji said, and Mukundji, you mentioned about smaller localized effort. So I just wanted to share one more piece of information. Like in Fremont, we have a senior care center, even though it is a city-driven program, but within that city-driven program, a person is managing a senior group of maybe 50, 60 people who are all Desis. So it caters to like their needs, and the activities revolve around their needs, and they meet once a week. And parents, meaning they can come to that common location, they get free lunch, and then they do certain activities including yoga, prayers, whatever, So these type of efforts can also address the loneliness problem to some extent, as long as they are reasonably fit to come to a given location.
Yeah. Thank you. Mahaji, and then Rita ji.
Thank you, Dr. Mukundji. You were specifically asking if we have had experiences and we have learned something, a thing or two, and I'd be most happy to share that with the recent, crisis that we had in our family with my father going into respiratory distress. We come from a family of many doctors, and yet, in in our situation, we always positively think about our parents, that nothing can happen to them. And even though we have discussed certain things, in some ways I feel like when my dad was ready to come back from the ICU to home, as excited as we were scrambling to find out and set up the care at home, because we knew realistically it cannot be just us, it has to be someone else as well that's qualified, like a nursing assistant. And having been away from home, India, for a long time, even though we visit regularly, these are things that we didn't look into. Maybe romanticizing that our parents will be there forever, and not trying to put ourselves down. But I also wish one thing, that retrospectively, that we could have proactively just looked into the area, like you were talking about, Dr. Mukundji. There are resources available. I'm sure in India perhaps it's harder, but it's there. And when the fire is not already up there, we could just have also looked into what are the local resources. If we needed home care for our parents, what could we do, those kind of things. And although we were lucky to find things, it was a struggle for about a week, trying to get the right care, references, etc., etc. So in the US, as you've pointed out, there's so many resources to know, at least for those families who have elders close by or at home or even far away, to proactively look for that will be helpful. So if a fire had to come out, to put it out or to be part of a productive healthcare team, it'll be a little bit more easier or a smoother transition.
Thank you. And I appreciate the fact that you're sharing the personal thing that's going on right now for you and your family. That's not easy to do sometimes. But it just points to just the logic of it, right? If you know that something is likely to happen, if you are better prepared for it, whether it hopefully it doesn't happen, but if it does, you're better prepared to deal with it than dealing with it in a crisis mode. And that's just the general message that I was trying to convey with this. And then identify in detail what are some of the areas that you have to look at. So hopefully that's clear.
Absolutely.
Any other questions or thoughts? I'm not keeping track of time, Anita ji, so you have to let us know when. Sorry, say that again.
I'm saying that we should take a break right now.
Okay.
Yeah, it's already 8:35, so.
So how long should the break be? When do we come back?
3:45.
3:45?
Yeah.
Okay, very good. Thank you. So Anitaji, should we start? Should we wait for a minute or let me know?
Yeah, I'm just checking. Hello? Can you all hear me?
We can't hear you, Anita ji.
Okay. Yeah, welcome back everyone. I was just checking next to see if everybody's back.
Okay, so let me get started and share my screen. And if you're not speaking, if you could go on mute, that would help. So I know it's a very long day for all of you to sit and focus and pay attention in a concentrated way for 3 hours in a row. So we'll try and make sure that we give you the information, but get you off on time as well. So thanks for staying on and listening. So this is the third lecture for the day, and the focus here, we've talked quite a bit about caregivers in the context of people requiring care. So this next lecture covers a very important aspect, which is caring for the caregivers themselves. So, and that's the objective of the course. I will briefly touch upon some additional details on the caregiving crisis in the US and define what are the critical issues that face people who are giving care to others. And then I'm going to spend most of the rest of the time talking about techniques and kind of give a toolkit for the caregiver to look after herself or look after himself in the best way possible. And as I've told you with every other course, your takeaway should be, what can I learn from this for myself? What can I learn from this for my family and friends? And how can I use this in the context of serving others in the future when I do that? So we are focusing on the family caregiver and not on the person receiving the care. Okay? Most of you will recognize the name of Rosalind Carter. Jimmy Carter was the president of the United States from 76 through 80, and Rosalind Carter was then the first lady. And after leaving the White House, going back to Georgia, she started a well-known institute now called the Rosalind Carter Institute for Caregiving. And this is a quote that Rosalind Carter made in one of her talks. She says, "There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who need caregivers," right? So in the construct of our lives, at some point, the caregiving role is going to touch our lives no matter what, guaranteed 100%, right? The same report that I referenced to you in the previous lecture has some additional details in terms of the caregivers that I think are useful for this talk. And this goes back to the data collected in 2020. It said that 1 in 5 people that were polled, and they did some extensive polling across the US, 1 in 5 have provided care to an adult or a child with special needs at some time in the previous year. Whether it's for a day, whether it be for all 12 months, at some point, people have had to play the role of caregiver. 1 in every 5 people in the US, quite a large number, right? 53 million adults are family caregivers on a regular basis. And compared to 5 years before, compared to 2015, this is an increase of 22%. So if you look at the same rate of increase, I suspect it's going to grow larger than that at a far higher rate. Caregiving is going to touch a remarkable number of people, right? Of those caregivers, of those 53 million adults, 1/4 of them actually have cared for more than one person at the same time, right? They're caring for at least two people. And this represents a 1/3 increase in 5 years, 33% increase in 5 years. Now, no surprise to you ladies on the call, 61% of the caregivers are women, right? And the average age of caregivers that goes down to actually very, early adulthood. The average age of caregivers is 49 years, close to 50 years. And 1 in 10 is actually studying while looking after a loved one, presumably a parent or an older sibling or a friend or someone like that. 1 in 10 is a college student. This gives you some idea of when we talk about caregivers, whom are we talking about, right? And what number? So what do these caregivers do? 90%, vast majority of them are either caring for a parent or an in-law, are caring for a spouse or partner, or caring for a grandparent or grandparent of a spouse. And 6% of them are actually caring for an adult child. In fact, I know somebody here in the Bay Area who came to me with some requests for some assistance recently, who has a 42-year-old son dealing with autism. And this son needs looking after, right? It turns out that it's not always family. 1 in 10, 10% care for a friend or neighbor, which speaks to the kind of community spirit we as human beings have. We care for the people in our circle. Yeah. This bullet has a lot of 75s in it, but 75% of caregivers aged 75 or older care for someone who's aged 75 or older. So think a bit of this as the older people are typically tending to look after someone in their own age group, or spouse, or a friend, or somebody like that. Okay. And a dominant number, 81% of all these people who are aged 18 to 49, care for someone who's above 50. So this gives you some idea of who cares for whom and what the demographics of that are. Okay. So we use the term caregivers, but how many of us really understand what it is that is meant by giving care? And there's a variety of different things, and I'll list some of them here. You remember I recall mentioning the instrumental activities of daily living and the activities of daily living in the previous lecture. So almost all of them, 99%, help that person that they're looking after with one or more instrumental activities daily living. Driving the person from here to there, taking that person for a walk, helping that person do some banking or go to the post office or buy groceries and bring them home, that kind of a thing. 60% help with actually looking after the person physically, with the daily living, the brushing of the teeth, the grooming, the dressing, the bathing, the eating, all of that things that you need to just look after yourself every day. Getting in and out of bed, going to the bathroom, right? Almost the same number, 58%, perform medical and nursing tasks. Some of them are trained to do this, change bandages, those kinds of things. You can imagine a list of medical tasks that could be performed at home, right? Rakiji mentioned seniors managing their own medications being one of the concerns of geriatricians, right? So at some point, someone takes over their medications and manages the medications for them. Make sure they take the right medication at the right time on a daily basis, get the refills, consult the physician as needed, and those kinds of things, right? Half of them provide as care coordinators across all the different sources that are providing care to the patient. And often it's not just one person. If you're living in a family, the primary caregiver will call upon other members of the family or community, even kids at home, to help some of these things, you know. So caregiving becomes a family operation, on at least in some instances and in some points in time. And I've talked about this issue, but if you think about the American system, our medical system, the hospitals, nursing homes, clinics, et cetera, takes as a given that there is a caregiver at home for a vast majority of people. If that caregiver wasn't there, the system in the US is not equipped to handle it. You know, if we didn't have personal caregivers, this thing about the entire medical system, caregiving system would come to a crashing halt, right? So family caregivers are woven into the fabric of our health, social, economic, and support systems. Okay? We don't think about it, but this is an important fact to understand. And I've given you this number before. The caregivers provide $500 billion worth of unpaid care over 37 billion hours every year, right? So what happens? How long can this go on? You know, we as family and friends continue to step up and provide this unpaid care to whenever we believe it's needed, right? With anyone who has assistance for some health or functional need, right? But more and more people are getting old. It's going to become untenable at some point unless the caregivers also get some support, right? So supporting the caregivers is something that we have to have a policy at the federal government level, state government level, community level. We need to have activities formalized in such a way that it's given the support that it needs. Otherwise, system is not going to serve. So, you know, it's going to break at some point, right? The need of 24-hour personal care is increasing. Statistics show that it's only going to get worse. And private pay care is not many people can afford. To bring a nurse into the house, for example, typically in the Bay Area, give you some numbers. $35 to $40 an hour is what a nurse would probably charge. No one is going to work to come for the minimum they'll work is half a day. So if you think of $40 for 4 hours, right? How many people can pay $150, $200 a day for an unknown amount of time, just for nursing care and nothing else? Okay. So this is like a tsunami, a flood that's going to take over our lives. And so within this sort of a crisis situation, the question I ask you as scholars today is, who is going to look after the caregiver? And I'll tell you the answer. It has to come primarily from the caregiver herself or caregiver himself, right? We have to put on our own oxygen masks first before we can put an oxygen mask on a person like a child needing it next to us. Now, Maha and I sort of talked about this very, very briefly in one of the breaks, but caregiving actually has opportunities that come associated with it. You know, and I've been through this myself. Caring for a loved one is a very special thing to have to do. It's the loving devotion, compassion that you give is fulfilling to a person, right? So being there for someone you love, someone who loves you, is a core value to all of us. And this is something that we would like to do. We wish to provide this. So we hope this never has to happen. But when a loved one needs care, this is something that we will do with devotion, with pride, with care. Right? So it's an opportunity that we will, this came upon us, we will fulfill that role, right? It also helps bring out, it helps us understand our own character and the character of the person we're looking after when we're dealing with this crisis between the two of us, right? One helping the other. And sometimes the one who's being, the person receiving care is also can provide care to the other, right? It works both ways, even though one is healthy and the other's not. There's a lot of joy in that personal, very personal, intense interaction. There's hope, there's faith, there's some healing, there's a strengthening of character of one that happens through that. So there's a joyfulness, there's a sukham that comes with it. And so caregiving is a special experience that helps one grow and helps one in one's own life journey, if you will, in a way, right? And caregiving is like being a project manager for a complex project out in business and industry. You cannot survive as a caregiver without improving a lot of skills of your own, right? Your time management skills, your ability to organize things, you're looking after someone day and night. How do you do all the myriad things that you will? How do you fit it into the day? You have to figure out, you have to plan, you have to organize, you have to figure out what time to allocate to each task. You have to figure out, think ahead to understand if I need to do the laundry and still do this, I'd better get so-and-so tasks done first, so then I have time for the laundry, etc., etc., etc. You see what I mean? Even mundane tasks, they help develop time management skills, organizational abilities, right? In a moment of crisis, family comes together. If a sibling or a parent is unwell, then the others rally around. And so the caregiving situation brings enhanced opportunities for dynamics between family members, and people who didn't get along well before start to understand each other and support each other. It can work the other way also. We have to try and avoid that. It can improve relationships with the parents, the spouse or friend. It helps us understand ourselves better. We have to understand ourselves in order to be able to manage ourselves, right? So it helps us do that. And things that we thought were important before suddenly become trivial. So giving care sort of helps you prioritize life in terms of what is most important in life. You know, what are trivial things that we shouldn't even be worrying or thinking about. And you get a sense of paying back. If someone has helped you, you are in turn helping them back. There's a sense of helping pay back. So caregiving has, this is what I mean by opportunities. There's a lot of goodness to oneself that comes from providing help to others. Right? But as most of you who've done caregiving, and I'm sure many of you have, also comes with challenges. You're not giving up something else to do this. Some of us may have the luxury to do that, but many of us have to continue raising our families, looking after our things, going to the job, doing all of that stuff. And in addition to all of that, we're taking on the new role of caregiver. So days get exhausting. There are struggles, there are worries, the new responsibilities that one has to deal with. And then there's a lot of emotion that comes with it, right? And I've personally been through all of these, so I can attest to that. there's a guilt that maybe if you had done something earlier, something, this need not have happened. Maybe you're not doing enough, right? There's some sense of resentment. Why did this have to happen to us? You know, what did we do to deserve this situation that we find ourselves in? There's the fear of the future. There's some sadness and grief. There's some depression that can come from just the exhaustion, the loneliness, other things. We're embarrassed about certain things. Some embarrassment comes up because we behave in a way that we didn't want to. And then there's anger at the whole situation, right? So there's a spectrum of emotions that you have to constantly deal with and understand, make sure put those emotions aside so that you can work in do what you have to do in a constructive manner, right? So this high level of stress, physical and emotional stress, can lead to burnout and health issues too. And that's one thing we have to be careful of. We have to make sure that in looking after somebody else, we don't put ourselves in a position that we require care from others, or we're not able to do our job properly. So health problems have to be dealt with. And so if you look at this whole picture of challenges, if you can make yourself physically and emotionally healthy to the extent you can, you will do a better job at giving care, and you will feel better for yourself for doing it that way. So your physical and emotional health is critical as a caregiver. So now this is like the frog being boiled. 1 degree at a time, doesn't realize it's being boiled, right? Just getting warmer and warmer. Sometimes we don't see the signs of our own stress till it's too late. So it's good to understand what the signs of caregiver stress are. So if you're feeling overwhelmed or constantly worried about things, you're tired more often than you used to. Either you're sleeping too much or you're not getting enough sleep. Both things happen, by the way. Not at the same time, of course, but it can happen. Your diet or exercise is not correct. You can be gaining weight. You can be losing weight. You become angry easier. You become irritated more easily. Your emotions don't have control. Things that you used to enjoy doing are no longer interesting to you. All of these are signs of stress. And it's good to know that if you can spot some of these, to relate that to the fact that it's stress that's the cause of all of this, right? Sadness leads to depression and other things. And then physical problems, headache, body pain, this, that, the other, which can be a byproduct of all these other things happening, are all signs of caregiver stress. And then in some people, to get relief, they begin to take or abuse their own medications. And in some cases, in our community, other communities as well, excess alcohol, drugs, these become problems. Okay. That report that I talked to you about from 2020, that part of the survey, they asked caregivers about what their factors were. And these were the top 5 or 6 things that caregivers reported. Not enough sleep, bad eating habits, didn't exercise, didn't look after themselves and take care of themselves, and made their illness worse when they fell ill. And then not looking after themselves, especially medical appointments for themselves. These were the top factors listed. So we as caregivers must make sure that we don't fall into these traps of that'll just make things worse for ourselves and worse for the person we're looking after. So it is upon ourselves to take responsibility for our own care. And it's not easy to do. Each one of us has to ask ourselves, think through things, and identify what is preventing ourselves from not dealing with, not looking after ourselves better. Some of us say, I can't put myself first, right? I'll be selfish. I need to look after the other person first. And then if I have time, I'll look after myself. That's not right, logically speaking, right? You may be guilty that you're thinking of your own needs when the other person needs so much more. You're afraid of that. What is that fear about? All of us may not have all of these issues, but these are some of the things that are commonly faced by caregivers, right? I'm too proud to ask for your help. I don't want other people to think I'm not capable of looking after this person, right? That's an emotion that some people have. Inadequacy, feeling that other people think less of you because you think you need help, right? Sometimes we feel we have to prove ourselves to the person we're giving the care to. Am I worthy of the affection that this person is giving, or do I have to do more? So as a result of that, I do too much. Sometimes it's a good idea to let that person be independent as much as they can, maintain their independence, maintain their dignity, rather than say, no, you can't do this, no, you can't do that, don't walk, don't do this, don't do that, right? So that there's a tendency to do that as well. So those are some of the things to watch for. And then I propose to you a little box that I'll give you, a figurative box, a toolkit that you open up and look at some of the things you can use to help yourself, right? Figure out ways to reduce your personal stress. And everyone has different ways. You might want to listen to music, meditate, do yoga, exercise, whatever it is. Set goals for yourself. Over the next week or 2 weeks or month, these are the things that I need to have done. Define those goals, make them reasonable, achievable goals. And then when you reach the goals, you feel good that you've achieved them, rather than this is an open-ended problem. I'm just going to keep doing things every day. Set goals for yourself. If there's a problem, look for a solution. If you can't find it, look for help to get the support. In dealing with caregiving, you're communicating all the time with the patient, you're communicating with the family members, you're communicating with the support healthcare system and so on. Leave emotion out of things, communicate constructively. Anger, bitterness, irritation, don't get anywhere. And laying the blame on other people or taking the blame happens a lot. Those things don't work either. So constructive discussion, communication, dialogue with others, right? Absolutely ask for help, absolutely accept help. When you can, give jobs to others. If you need to, seek help professionally, right? And when you talk to the doctors about the patient's medication or patient's health condition and so on, don't forget to talk to the doctor about your own self, right? Rakiji mentioned this. Exercise and looking after your health, diet, nutrition, sleep, all of those are important things in looking after yourself. And thinking about your emotions, why you did something, why you said something, learning from that for the next time will help you go a long way in becoming a better caregiver without burnout, etc. Some more strategies. Know that you're not superwoman or superman, right? As much as you'd like to be. Know what your limitations are and work within them. Figure out what it is you can do and focus on that. Don't stress about what you're unable to do, what's out of your control, right? It's pointless because it's not something you can control. But a lot of us don't do that. We keep fretting about, what we could have done and what we're unable to do. In that line of thought, set realistic goals for yourself. Make connections with friends, with family, with support groups, with others dealing with the same issue, kind of thing if you can. So that connection helps you share best experiences, best practices, but also helps relieve a sense of isolation that I'm the only person dealing with this and there's no one else in the world that's going through what I'm going, right? So joining a support group sometimes helps when not just the patient, but the caregiver too. And more there are caregiver support groups that are coming up across the country. Look for support within your friend and family circle if you're able to. Set goals for your own health. Don't forget your checkups, your doctor, your dentist, your optician. Make sure your health is good, right? And understand that you're not alone, that if you seek it out, you will find people who are there to support you. So self-care involves a number of things. Showing kindness to yourself, compassion to yourself. I talked about self-compassion in a prior lecture. Understanding what you cannot control and letting go of that. This is an interesting idea that I've tried and works for a while. What are all the things that make you happy on a day, week, month, year basis? Make a list of that and try and get some of those things for yourself. Meditation, mindfulness, whatever it is, yoga works for a lot of people. I love to listen to music. When I'm stressed, I put on headphones and listen to music, right? If you have a friend that you can vent your anger, your frustrations, your irritation, go talk to that friend, vent, get it out of your system. Don't bottle it up, right? And invest in yourself is a term I've heard. So invest in yourself, pamper and reward yourself. Eat healthy, sleep well, stay active, try and be happy. Over about that arching stress that you're dealing with in looking care of that person. Reflection, natural therapy, practicing gratitude, being thankful for things. All of these helps you heal internally and make you better. And some people claim that writing every day in a journal is good. If you believe in that, just write for stress relief. It's a way of venting on paper, if you will, right? Laugh about something every day, talk to somebody every day. And this is applies to men as well as women. Give yourself permission to cry once in a while. Emotions aren't bad. Tears help. They're not a weakness. They reduce tension. They get stuff out of your system, right? Getting adequate rest is key. And then having a wind down routine, especially in this social media age, putting that phone aside, the WhatsApp messages, the texts, put away all the sources of tension before bedtime, unwind, and then sleep. Okay. So you can be a better, more conscious caregiver if you look after yourself well. I've got a set of references here, links that you can look at your leisure afterward if you want to follow, think more about this and get some more material to study. And so with that, it's what, 4:20. Anita ji, I think we have time for some questions or comments or discussion.
Yes, we do. Yeah, we have about 20 minutes for that.
So the floor is open. Let me start with a question with you folks for a change. How many of you have either been a caregiver, is currently a caregiver, or know someone who's been a caregiver or is currently a caregiver? Just a show of hands. Yeah. Mahaji is clearly in that process right now. So a few of us, right? But if you think about it, you can look back at that experience or yours or others, and ask how good was care for the caregiver, that as well as you were. If you were the caregiver, did you do an adequate job knowing what you know now? If someone else is giving care, are you able now to talk to that person and explain to them the importance of looking after themselves well? Intuitively, we'll say, yeah, this is obvious, right? You have to take care of yourself first. But how many of us actually do that? In that moment of crisis, how many have actually pay attention to that and then come at it from a systematic, holistic, regular way, right? And that's, in these lectures, there's nothing new. I'm not inventing a new theory or philosophy or science here, just putting together observations that all of us in our life experience are aware of, but putting that in the construct of here's a method, a process, a way, and that's what you want to take away from this. And hopefully it helps you help somebody else. Did you have a question or comment, Rita ji?
No, Mukundji, I just want to have some suggestion or my experience with the caregivers.
Please.
I can tell you that I was so good, and not to praise myself, but I was listening and getting compliments from others when I was young age, okay? I was working part-time or even full-time. Sometimes I was helping the people and I was so good. But since I turned 50 and then it's like, now I don't like to do the caregivers because I get scared. Oh my God, what happened if I can get Alzheimer? I'm going to be just like that. I'm going to be worse. So those kind of negative feeling comes, so I always suggest, like, when you are young, you serve better. That's what my experience with giving the food and, give the company. And I was really so good. And people used to praise so much about it. But now I withdraw myself for the caregiving. Because the way I said, I get more scared. Like whatever I see, I always think what happened in the future if I can get.
So Rita ji, I guess the message is, first, thank you for sharing that. And I appreciate the fact that you felt good about the care that you gave. And I'm sure that must sit well in your heart. But all you need to do now when you get scared is talk to your younger self and ask your younger self to guide you. That younger self is still within you.
Within me, yeah.
Hasn't gone anywhere, right?
Right.
Just pull her out and bring her along for the journey.
Sounds good.
That's a great hint. Great advice. Like,
I know, it's a great advice.
A lot of times we feel like we cannot do the things that we did in the past, but I think that inner self, if we bring back, I think as Mukundji said, it's
absolutely. And then you read more, you listen more, you do look at it more, and that make you like always think about I hope it won't happen to me. It's like, what happened if I'm like in that situation? So it's kind of but the way you said, so many times I tell not to get scared in family or anything, but I cannot do it like I used to do often before. Anybody and everybody in the community, which is like, now I pose back like, okay, do something different. I like to work with the children now more. With the children, I can do it more, give the advice, take care of them. Even special need kids, I'm like so good with them, but not the older people.
But I guess the point I'd make to you is that it is okay to be scared,
No, it's not.
It is okay to be worried. It's okay to be apprehensive about things, right? Mm-hmm. That's all. Those are just signs of wanting to do the right thing. And so that gives you the impetus, if you will, to figure out what are the right things. You can analyze that. What are you worried about? What is driving you to be apprehensive about things? And then get help in those areas or get some support in those areas, right? So this toolkit that I talk about is just building self-awareness of yourself and understanding where your needs are while making sure you look after yourself well.
Thank you.
I know it's been a very long day for most of us, and there's certainly time for more questions, and I'm happy to stay longer. But if there are no other questions, then I think what we can do.
I can go over the closing.
Move on to the next, and then give people back some of their time.
Sure.
Right?
Yes.
So let me just ask once more. Anyone else have any thoughts, final questions, comments, or suggestions for the group? Any discussion you'd like to have?
Mukundji, you brought up very important points and it was very good. Many years back, myself and my husband took care of his grandparents in India, and all their children were living in the US. So it was a tough time, but very fulfilling, and we made a tangible difference in their lives for like 8 years. So yes, it required a lot of support for us, and because their children were here, we could not get the caregiver support. But a lot of the things you touched upon and you highlighted now comes back to my memory. This happened like more than 2 decades back, and now we came here. But you bring back like very fulfilling memories of that.
I'm so happy it resonates with you. Thank you.
Mukundji.
Thank you, Mukundji.
Yes, Mahaji, you had a question or comment?
Yes, I don't want to sound repetitive, but yes, everything that you just brought about with self-care for caregivers resonates so deeply with me, as you know, because this assignment is so relevant to me because we did get thrown into a sudden situation where a family member went into, an emergency situation. And so that is one of the first things we neglected is self-care, because the intention, like you said, is to take care of that family member. So Lord, all of the things that you pointed out has been so helpful for us. We went into that thinking mode about a week after the emergency, because at some point you just get exhausted, but you don't want to stop, because we somehow think us staying up at night, us being there every second of every minute of every day will make a big change to bring dad back to better health. And sometimes, that's not true. It's in God's hands, it's in the hands of healthcare professionals. And of course, we are part of the healthcare team, but sometimes you fail to recognize it because of a sense of guilt, because of emotions, because of love. And it's so important. Everything that you said just resonates so much because it's so fresh. In fact, I stepped away 5 minutes ago because my dad's BiPAP started beeping. But what was so touching in what you said that I recognize, and sometimes those feelings come to my mind, is you said something about empowerment, joy, and that's so true. Because in these kind of situations, the worst of us and the best of us come out. And even though you know your siblings so well, your extended family members so well, when you see that, when you witness it, as human beings, you are empowered by it. And all of that is something I've experienced through these last 30 days, I would say. And thank you for bringing this up as a course subject in this CHT course. I think it's so essential. Like I mentioned before, and I can't reiterate it again and again, that we have to pretend, like today's assignment is so relevant. Pretend that you're suddenly thrown into a situation where you're in an emergency and you've become a caregiver. What do you do? And this is something that, every one of us has to think. I know there are a lot of young ones in here, but many of us are parents that are, older. And it's something that, we feel like it's strategizing, and we think about it as a, business venture and shy away from it. But we have to strategize because that's the best thing, that gift that we can give to our loved ones, whether it's our elders, whether it's an ailing child. I think this is the most important thing to strategize about with families.
So
thank you so much
for that validation, and also for sharing the the personal experience you're concurrently. I must say I admire you for sitting in the class while you're in real time looking after your father. It's not easy to do, but your experience is validating what I'm trying to say here, and hopefully that combination of your real-time experience commentary and my theoretical framework will help the rest of the class also internalize some of these things and be proactive and not wait till you suddenly hit that brick wall, right? So
yes, I had to go totally out of my comfort zone. Number one, to log into class. I did miss, I think, one session before. Number one, to log into class. Number two, to share. And believe it or not, I do think the more I hear your lecture, that even me sitting in this class, Mukundji, is part of my self-care. And of course, by God's blessing, we have the luxury where my dad's sleep pattern at night is getting better, because we started this class at 2:30 a.m. So that's my shift, ironically, that me and my sister agreed to. So we have that luxury, so I can join the class. And to me, this is very relevant, and it's part of my self-care, to be very honest. And 1 month ago or 3 months ago, I would have hesitated to, first of all, join, to second of all, even share. So thank you for giving us the space, giving me the space to do that here. This is very important.
And my thanks to you as well. Best wishes for you and the family in this continuing situation that you're dealing with. So
I really appreciate that. Thank you.
Geetaji?
Yes. Thank you, Mukundji, for bringing, highlighting all the responsibilities and toolkits to take care of caregivers. Of course, Mahaji also know, and she's a good supporter of everyone in society. Maiko, it's a kind of, is it, I think a social support also really helps for the caregiver sometimes, because when the caregiver, when he or she was not able to do what to do, or when he or she was not in a correct condition, or not even in a position to take the decisions what to do, and I think social support, it has made a big difference for the caregivers to make a caregiver to do good decisions and do his or her responsibilities in a good way. I think it is my personal experience. And I was really, when you are telling, I don't have any word or any talk, just I am listening and rewinding all the things whatever we have faced. But I wish I could have taken this class before, so that I could have done more better my responsibilities. That's what I am thinking. Thank you very much, Mukundji, for giving all the tools and kits for the caregiver, so that one can do in a better way.
You're quite welcome, Geetaji, and you're quite absolutely correct that social support is critical in this situation. And so that's the other thing that you can be proactive in planning for ahead of time, so that you can have a network that is going to support each other in moments of crisis, no matter what. So yeah. Ratnaji?
I just had one comment. I mean, I enjoyed the class thoroughly, meaning it was very educative, and then it was opening eyes from a different angle, or from all angles, I should say. One thing I feel that we know so many caregivers in our environment, like in the sense in our surroundings, we are filled with so many caregivers giving care to so many different kinds of people going through so many different situations. So as an individual, I think what we can do is like empathize the caregivers. We always ask, like, how is that person doing? How is this person doing? And we forget, like, who is taking care of them, empathizing them and telling them that you are on the right path. we are there with you, just go ahead and do what is needed, I think gives them a big shoulder to lean on. That is more important, I think, because they know what to do at that minute, but telling them that we are there holding your hand, we are there to support you, is itself a big thing, I feel. And your toolkit definitely is very important, so we can share it with whomever we know are the caregivers.
And thank you for that, Ratnaji. That's precisely right. When I say in my lectures, when you come into this lecture, ask yourself, what can you learn for yourself? What can you learn for your family? And what can you learn from the point of view of community service? What you've just mentioned is exactly a good example of that. How can I use this lecture, the contents, to be of service to others, whether it be in the family or whether it be someone I don't know, someone who comes for help. So think of what you've learned in that context, even if you're not in a position to be a caregiver. Are you able now to share some of these with others you know, or others you may come to know in a constructive way? So thank you.
Thank you.
Any last thoughts or questions or discussions? If not, thank you for listening. I know these are not easy topics, and 3 hours of that sustained is quite draining, I'm sure. So you are.
Can we go through the homework? What is needed?
That's the next thing that we're going to get to.
Thank you.
I just wanted to make sure we closed up the lecture part of it, and then now I can hand it back to Anita ji, and she's going to do precisely that.
Thank you, Mukund ji. Yeah, that's a very informed session for everyone. I think, including myself, I'm listening to this for the second time, but it's always good to listen and understand it more. I hope everybody had a good chance of like getting into this, and we will be either helping our own families or like the future, like if any one of you have decided to become the counselors, like that would really help like the future participants or anybody in the community. We can be a better informer, like with the proper messages, I think, with these lectures that we had. I hope everybody gets that good feel about it. Okay, let me share my screen here with everyone, and let me know if you can see my Word doc here for. Let me start with the 400 because it's just now we finished this homework, like this part of the lecture. So that way it's just reflects to what we just spoke, and I'll go back to the homework sessions for 200 and 300. So the homework for this week for this session is assignment says, assume that you're suddenly put in a position of being a caregiver unless you currently are or having been a caregiver in the past, in which case you can draw upon that experience, conduct an honest self-assessment and identify some personal barriers you might have for good self-care. Describe the self-care strategy you would devise for yourself to overcome these barriers. Your answer should reflect some of these discussions and presentation materials from today's lecture. Like anywhere like from 200 words is the maximum that we are expecting on this one. Any questions or any comments that you would like to make on this assignment? Okay.
So basically, you have to explain the personal barriers you might have for good self-care, right?
That's correct. Yeah. So as like being a caregiver, right? So
not for caregiver, for being caregiver like, yourself.
Yes.
Your strategy.
If you're putting yourself in that position of a caregiver, how do you feel like what would be the personal barriers that you could have come across, or how you would better take care of yourself, like after going through this lecture or information that we had just now added?
Thank you.
What might be some of the things that are preventing you from taking care of yourself the way you should, but you're not.
Okay. Any other questions, anyone?
So Radhaji is here. I just want to clarify, we have to list the barriers and then list the solution to the barriers that we have used.
Yeah, you could list it like it's totally up to you, like, or you can personalize like a short overview of the barriers you're coming across, and then how you can overcome these barriers. Like, how do you think you can overcome those barriers?
Again, the idea of the exercise is basically to ask to get you to think about your own self in this condition. What might, in this situation, what might prevent you from looking after yourself? Is it that and I listed some of those things in the lecture. I won't go through that again. Maybe there's some other things that apply that you are aware of. What prevents you from looking after yourself the way you know you should, but you're not? And then once you've identified that, giving yourself a little formula, a self-prescription to become, to care for yourself well.
Yeah, I could give some like, this is just like my personal example, I should say. Like, so if you're thinking like, oh, like you're put yourself as a caregiver, and then you're working like towards with somebody on that, and you don't even take any break from that, you're mentally like and physically broke down after some time, right? So just getting away from the situation, asking for help, like from somebody like who can take care of the person, and then you take a break from that situation for yourself and go relax and watch a movie or whatever makes you good, right? So listening to the music, as somebody like Mukundji mentioned, what can you do? Something that you can feel better about yourself, and you're refreshed to take care of the person or caring person that you're taking care, like in a better way, like so. Any other questions or comments? Okay, I'll move on to the lesson 200, Rakiji's lecture. This is about the dementia and cognitive vitality and dementia lecture that we had. The homework for this is after learning about the cognition, brain health, and dementia, what specific practices will you encourage community members and caregivers to follow? Additionally, what would you add in your own regular practices to get one more robust path towards optimal brain health? Your answers should reflect some of the suggestions made in the lecture. So basically, like healthy eating habits, or healthy eating habits was one of them, and how you can do social activities, like so that you're more active and socially and involved in something else. So those are some of the ones that we are mentioned in the lecture, but anything that might help you like towards better cognition and brain health. Any comments or questions on this area? Or on the homework in general? Okay. The next one is aging topic 300. And this was the fundamentals of elder care and geriatrics by Dr. Mukundji. So the homework for this is after learning about specifics of geriatrics, elder care, the challenges and some solutions, what specific practices would you advocate in your community to support older adults and their families? Your answer should reflect some of the suggestions again made in the lecture. So, or something you can bring in on your own, like that's not listed here also is encouraged, like just to understand like what can be done in a better way. So Any questions on this one? Okay. So these are a pretty self-explanatory questions, and something that you would put in your own day-to-day, like if you're caring for any elder person, we can go over those. And if anything else is there, one second, let me see, somebody has added something in the chat.
When the assignment is due?
It's like you have 2 weeks from today, like for doing the assignment. Okay. And after that, we will be grading after 3 weeks. I think 2 weeks after that.
Okay, thank you.
Sure. And I think there's some issues.
Thank you, Mukunji.
Sorry, say that again.
I said thank you so much, Mukunji and Anitaji, both of you.
Oh,
thank you.
You're quite welcome. Thank you. Thank you.
Most of the work was done by Mukunji and Rakiji. So I'm just
you coordinated too.
Thank you all for spending this Sunday afternoon. It's like a very valuable time, and that you chose to be here. So I think, but it's well worth to everyone.
Thank you so much.
And I'll just do the closing prayers right now. So. Okay, let's sit. Everyone get straight. Close your eyes. Om Sarve Bhavantu Sukhina, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kashchit Dukha Bhavat. Om Shanti Shanti Shanti. Hari Om. Thank you all for joining today, and anything, please reach out like to me, and I can always circle back with Mukunji on any of the questions you have and get back to you if I'm not aware of them.
Thank you. And my best wishes to each and every one of you and your families for a healthy, happy, and productive new year.
Thank you.
Same to you.
Thank you.
Same to you. Same to all of you.
Hari Om, Namaste. Thank you so much for this beautiful lecture and lecture series, and clubbed together so effectively and very, very relevant for people like me, and I'm sure others too, although we don't want any of our elders or community members to get sick. It's such a relevant topic to be added to our course. Thank you so much, Mukunji, and Anitaji, thank you for coordinating this.
Thank you all. Have a wonderful evening.
Take care there itself. Be safe.
Thanks, Anitaji. Bye-bye.
Thank
Everyone
you.
be safe. Thank you. Bye.
Thank you, Anitaji. Bye.